First, I'm going to tell you about his book. It's called The Real CDC. You can pre-order it right now at therealcdc.com. All right, and let's bring on our special guest of the evening here, John Beaudoin. John, how are you tonight?
Doing well. Thanks for having me. Hello to Minnesota.
Minnesota says hello back to you. And thanks for joining us here, John. And by the way, special guest co-host tonight, Ken McCarthy is joining us as well. So everyone say hello to Ken. I know everyone knows Ken here at Mask Off Minnesota land. So good to see you, Ken.
Thanks for having me.
We're super excited to have both you gentlemen here this evening here. So John has quite the presentation for us this evening, folks. So be prepared to take some notes. There's going to be a lot of heavy-hitting information here. I'm going to go ahead and make John the presenter. He's got some slides and some data to share with us here. So John, whenever you're ready, go ahead and share your slides with us. There we go. They look great. All right, John, and go ahead and take it away, my friend.
All right. I guess I'll start by commenting on some of the things that you had mentioned. You brought up a guy that had a J18.9. That's pneumonia unspecified. It's kind of the unspecified categories are kind of a dumping ground for, I don't want to say lazy, but some of the medical examiners do 400 plus death certificates each year. With each one, there's sometimes an autopsy, sometimes just a file review, but it's a lot of work. And in order to figure out which one they should specifically use would take time. Because it said there was a streptococcus and one of the enterobacterias, I forget which one, but that was also on there. Clearly that was a J15, not a J189. So the J189 was unspecified, it's a dumping ground. Now, if you look at what happened with the J12s, which is viral pneumonia, and the J189s, the same thing happened, the same pattern in Massachusetts happened with COVID and with all-cause deaths. So you had a spike in 20, and then it went down in 21. The marginal difference was cut in half. In other words, the excess that occurred in 20 was cut in half in 21. And that's in every one I just mentioned. So viral pneumonia, pneumonia unspecified, COVID, and all-cause deaths. Well, guess what happened with bacterial pneumonia? It went up slightly. Not only did it not get cut in half, it actually went up. And there were a number of reasons for that. One is the use of ventilators, which causes bacterial pneumonia. It almost always does. And some of the records I got from Minnesota, I'm not going to get too deeply into those because it gets a little emotional, and I've spent a lot of time in it. Every one of them had died from acute renal failure. Two were remdesivir, two were baricitinib. All 5 had vancomycin. That's a very strong antibiotic that's known to kill the kidneys, and I'm told by doctors, no, that can't be it. So since they told me, no, that can't be it, now I think that's it, because doctors have been wrong about so much. But yeah, if you read the research papers, if you get too much vancomycin, it destroys your kidneys. What else did you say? You had another comment. Well, let me just get into the presentation so I don't, this is going to take a while. Stop me at any time. I'm going to talk really fast in order to get through these slides because I spent a lot of time doing it specifically for Minnesota. But I'm going to do a little review in Massachusetts first. Okay, here we go. All right, I have 2 publications. One is the Real CDC, but 2 weeks after that comes the CDC memorandum. The published version of the CDC memorandum is going to have false names inserted. Everything else is the same: the age, the death file number, the causes of death. But the names in Minnesota, and this has Minnesota. That's why I want to mention the 2 books, because the Real CDC is about Massachusetts. The CDC memorandum is Massachusetts and Minnesota. And then I'm going to write a book this year called The Real CDC Does Minnesota. And the subtitle, I'm kind of deciding, it might be The Pandemic is Moral, Not Viral. We have a pandemic of immorality in this country. All right. It's paperback. You can get it at therealcdc.com. It'll be out on February 29th, this week. Thousands of hours. Primary evidence I call case history, which is anecdotes. They use the word anecdote to relegate actual primary evidence to be subjugated by the data, right? all the research papers, the literature. And that was done from, I don't want to get into EBM, but it came out of Canada, 1960s, they passed a law. They came up with evidence-based medicine, was coined in 1981, I think, the first time it was used as a term. And then it pervaded every medical school in North America, including the United States, by 1992. And most of the doctors under 50 years old, they don't think for themselves. They bow to the central authority, which is why you have, and you can have, these hospital protocol murders. COVID could not have happened this way 10, 15 years earlier because the older doctors had not aged out. They had not retired. The doctors who think for themselves and who conducted medicine the way it should be had not retired. There were enough of them where they couldn't have pulled this 10 years ago, but they did when COVID happened because all the younger doctors who worked the long hours in the hospitals, most of them in the ER and so forth, came after 1992 medical school. And they bowed to the central authority because if they do anything differently, they put their license at risk. That's not what this presentation is about, but I thought it was important to mention. I could go deeper on that, but so science is not the way out of this. Okay, pragmatism and individual discerning mind are the way out of this. Everybody has to think for themselves. You can't abdicate your thinking to a white coat or somebody with letters after their name. I've worked with many in my career, not in medicine, but in semiconductor research. And just because somebody has a PhD does not make them intelligent. All right, the book, there are 4 sections. The first one is about people. I usually do the presentation backwards, but I'm going to do people first in this one. But the book grabs the attention of people by talking about specific individuals. Cassidy was a 7-year-old girl. They said she died of COVID. She reacted in 5 minutes to the vaccine and died in 4.5 days. 3 strokes in 3 women in 3 months in early 2021. They knew. They knew in weeks the vaccine was killing people by stroke and by pulmonary emboly, and myocarditis is like 1% of the overall deaths from the vaccines. And yet that's all you hear about. All you hear about is spike protein, but the delivery mechanism itself being the lipid nanoparticle. There's antiphospholipid syndrome. There's all kinds of reactions people have to those lipids. It mimics your cell in order to slide into the cell. They have to coat the mRNA in this lipid to get it inside your cell, transfect, right? And that little piece of genetic material has to go join with what's in your cell to then produce spike protein. So before the spike is even presented to the edge of the cells, a lot of people are reacting. So the delivery mechanism itself, they could have put water or saline. They didn't even have to put mRNA, and they still would have killed hundreds of thousands of people. I do a little bit of Vermont. I talk about fraud in the book, and I'm getting the book out of the way so I can get into the Minnesota stuff. Only a couple of slides on this stuff. So the fraud, there's fraud of commission where you talked about it like they labeled everything with COVID. Well, each one of those is a federal felony, somewhere between 5 and 20 years for each crime committed. Now, it's just a matter of custom and practice by medical examiners and doctors throughout the COVID era to slap COVID on deaths that they know had nothing to do with COVID, including the accidental deaths that I found, hundreds of them, fentanyl overdoses, blunt force trauma to the head, blunt force trauma to the torso. 18 U.S.C. 1035 is false statements in healthcare matters. 18 U.S.C. 1040 is fraud in disaster relief. 1343 is fraud by wire. This is all fraud. These are serious crimes. Now, the fraud that's being committed leads to someone having a battery committed against them with a needle. It's a medical battery, right? You're injecting something that could potentially kill you. So given that they're committing fraud in an act where somebody the end result is a battery, where somebody's life is taken. I mean, I do an analysis to murder in the CDC memorandum. I won't go through that tonight, but it's a legal analysis to murder. So the second part, I correlate of the book. Fraud of commission, fraud of omission. Okay, they omitted vaccine as a cause of death being on the death certificates. I'll get into the ICD-10 codes and how they get there in a minute. Correlation, I correlate VAERS reports to death records. Female, age 73, died on March 13th. Okay, that's good. Well, there's three of them. All right, well, this one was diabetes, this one was a heart attack, and this one was pulmonary embolism with obesity. And then I find that the other record, the VAERS record, says the exact same thing. Like, okay, I got the right person, right cause of death, age, gender, date of death, and if there's multiples, sometimes I'll put the multiples on there, but sometimes I'll just say there's not a single other one that correlates 100% like this one does. Data analyses, I'll get into that quite a bit in this presentation. I did that for Massachusetts and I did it for Minnesota too. Solutions, I won't get into that here, but in the book, transparency is one solution. Another one is redefining epidemiology. The system that I put together to investigate and analyze causes of death, there's nothing else like it in the world. I can, if they were to share all the data with me, not only could I find out all the vaccine deaths, but I could say, hey, you know what? What happened in these 3 zip codes 39 years ago when people died of B-cell lymphocytic leukemia? Let's go look at the water supply. What happened in those years? I can find anything. Yeah, not anything, but a lot of stuff that they've never found. The investigation, or the investigatory methods that I'm using have never been done. There's no epidemiological investigation studies like I have done in the world that I know of ever. And what I did for COVID is how this came to be. All right. The thesis of the book, the symptom spectrum profile, that's the causes of death, the age spectrum profile, how old people are, by what cause, and the seasonality profile, when in the year do they die of what given cause at what ages. Okay, they all changed starkly on a year boundary, 20 to 21, coincident with the introduction of COVID vaccines, if you want to call them that. Now that's impossible. Diseases don't change how they kill you on a year boundary. All right. Now, yes, I'm in Massachusetts, but why is Massachusetts so important? I'm sorry, but Massachusetts did this to the world, along with New York and New Jersey. I'll tell you in the next slide, but Moderna's headquarters is in Massachusetts. Their R&D is in Massachusetts, some of the manufacturing. Pfizer's divisional headquarters for their mRNA vaccine is in Massachusetts. Massachusetts has 10 companies over $1 billion a year in pharma, $1 billion a year in revenue. 50 companies over $100 million a year in revenue in Massachusetts. The Boston Consulting Group. Walensky's from Massachusetts. We have Sanofi, Thermo Fisher, Novartis, Takeda, Biogen, Merck, Bristol Myers Squibb, Johnson & Johnson, AstraZeneca, Amgen, and GlaxoSmithKline. And if you read the red, these companies are all crooked. Now there's a guy in the left lower corner there, Jake Auchincloss. Is it Jake Auchincloss or Hugh Auchincloss? Well, it could be either, because Jake Auchincloss is my representative in the House of Representatives in Washington, D.C. And his father, Hugh Auchincloss, worked for Fauci for 20 years as the #2 man of NIAID. So when I say Massachusetts is responsible for all this, it is. And New York and New Jersey. And let's take a look. In the first year of COVID, I tracked all the country's purported COVID deaths. Now, Massachusetts was #3 in that teal blue across the top up there. New York and New Jersey were 1 and 2. And a distant fourth. Now, this is the world. This isn't the United States. These are any sovereign that has 3 million people or more. This is the entire world. When everybody was looking at the United States, they were really looking at New Jersey, New York, and Massachusetts purported COVID deaths. Sweden's in yellow, by the way. See, as time went on, when Sweden didn't do anything, no mask orders, they didn't have all this lockdown stuff. They were known to be open. They were the control. And they did better and better and better, and everybody passed them. More countries had people dying that were following rules and orders and protocols. Now, take a look in the box that I blew up here. On July 27, 2020, after the first big wave of COVID, New Jersey, New York, and Massachusetts. So New Jersey is a suburb of New York, really. A lot of executives live in northern New Jersey from New York. And the executives of the, BlackRock and so forth, Wall Street, okay, it's all about the money. with the pharma. At that point, it's all about the money, right? The military hadn't been shoving vaccines down our throats at that point yet through distribution. But the lies and fraud out of New York, Jessica Hockett, Jonathan Engler do a good job pointing out New York, and you can't get names for all the dead. You just can't get the names. It's nearly impossible for them to have had that many people die that they purport to have died. So they have massive fraud, but they can't. Nobody can get the New York data. I have the Massachusetts data, and I've proven at least 5,500. That's after they knocked off 4,000. After the first article was written by Joel Smalley, Metatron, and they within 2 weeks, Massachusetts said, "Oh, we made a mistake. 4,081 COVID deaths were wrong. They weren't really COVID deaths. Sorry about that." It's like, that's more than 20% of your purported COVID deaths. You just like, oh, sorry, boom. And nobody in Massachusetts said a word. Nobody complained and said, hey, you guys are like really fraudsters and liars and we shouldn't trust you. Nope, nobody said that. So anyway, what you see here is Belgium a distant fourth. And Belgium is a center of all that EU globalist BS stuff. They're trying to ram down everybody's throats. All right. Now, I wrote something called the Minnesota Memorandum, and I sent it in June, last June. And these, who did it go to? I went to somebody named Peggy. That would be Peggy Flanagan, Lieutenant Governor, I guess. Tim, who's Tim? Oh, he's a governor, Tim Walz.
He's
Keith,
the governor that locked us all down.
Keith is, what does it say here? Crook? Oh, no, Brooke. Brooke Cunningham. Keith Ellison is, oh, wow, he's an attorney general. How about that? And Brooke Cunningham, health commissioner. Sorry about that. I that's not a very nice thing to say, but whatever. So the beginning of this memorandum is a legal notice to the above named Minnesota officials jointly and severally, hereinafter known as the agents. The intent in providing this memorandum is to protect the health and safety of Minnesotans, hope I said that right, who are dying at alarming rates from a specific cause of death, not COVID. The best solution to act on recommendations is in the recommendations section. Now, I won't get into the Minnesota memorandum, but here is an example of acute renal failure in 55 to 64 age group and 25 to 44 age group. You have 269 excess deaths in 21 and 22. And that, I don't know if you can see my mouse, but you see the first two bars of that first set of bars? That's crazy. That's like nearly impossible. That should have the attention of every health professional in the entire United States, if not the world. This does not happen. And then you look at the 25 to 44 age group, you lost 63 excess people in 25 to 44 of acute renal failure. This is only a single cause of death. Now, in total, it's over 1,600 in Minnesota. I don't know if I have that. Yeah, I'll get into that later. So this was sent in June. It's the same kind of notice that the CDC memorandum is. It's the forerunner. I did one for Vermont. I did one for Minnesota. Now, none of these people, having received this certified mail, can ever say that they didn't know. They've been given notice. They know they're killing people, and they're not investigating. Now, the omission of conduct where there's a legal duty to act is a criminal offense. Those four people, whatever titles they want to put in front of their names, are criminals. Okay, a cursory review of the CDC memorandum as it pertains to Minnesota. It's pretty big. I'm going to go real fast through a lot of this stuff. If people want to go back, we can go back later, but here we go. That's it's being published, ISBN number there. I'll share the file later. So the last lines from the cover letter to the CDC memorandum. It's over. We know you know. Now do the right thing or be pursued as criminals for the rest of your lives. Every legal means will be pursued to ensure justice is meted and truth prevails. You have a rare opportunity to remediate your conduct and seek forgiveness. You should take it. May God judge you justly for your decisions and actions. And who does it go to? It goes to Mandy Cohen, director of the CDC, Nirav Shah, principal deputy director, Deborah Horry, Dylan George, Demetria Daskalakis, and then commissioner of the FDA, Robert Califf, principal deputy commissioner, Janet Woodcock, chief counsel, Mark Raza, this guy, Peter Marks, people have heard his name, Center for Biologics Evaluation Research. He knows darn well what's going on, and he's promoting death and murder of Americans. Hillary Marston, Namanje Bumpus, Lawrence Tabak, NIH. Now we're in the NIH. Okay, and people, if you don't understand, is NIH is National Institutes, plural, of Health. The NIAID is one of those institutes, the National Institute, singular, of Allergies and Infectious Diseases. That's where Fauci sat for all those years. So even though he was under the NIH, Francis Collins, who ran it then, he still was the highest paid employee in the United States because he was collecting on his retirement at the same time as collecting on his pay, which is illegal, but whatever. Who's gonna arrest him? Tara Schwetz, Eric Green, and Jean Marazzo. I'm still looking for people to serve these people with the CDC memorandum in its original unredacted form. The published version has fake names for Minnesotans. All right, Minnesota cases. On January, and these are not the real names of the people. If anybody sees a real name, please tell me, because I'm pretty sure I went through it 3 times to make sure that the names were not real. Unless I got specific permission. There, it's like 3 people I got specific permission from. All right. January 5th, 2021. Think about that, okay? The vaccine just came out, right? This is early January of 2021. He was 78 years old, died of sudden cardiac death, and on his death certificate it says SP COVID vaccine second dose 10 hours prior to death. So the prefix is Y590. Well, Y59 is a prefix, but Y59.0 is viral vaccines. And T50 and T88, I don't remember. T50 is another immunization medicament kind of thing. T88.1 is other complications following immunization not elsewhere classified. It's a generic immunization kind of code for death. They were not applied. February 24th, a month later, 77-year-old woman, out of hospital cardiac arrest for unclear reasons in 1 day. The patient had her second dose of coronavirus vaccine the day before her cardiac arrest. Gee, I wonder if it had anything to do with it. The case was reported to the CDC, though it is not clear, blah, blah, blah. And then code prefixes were not applied by the CDC. Now is a good time to explain. All the states send their death certificates to the CDC. The CDC has software called Transax and Acme. I have it in my in the published version and the other version, and it's cited, and there's a link, and you can go online. You can look up Transax and Acme. What that software does is it reads the English words that are on death certificates, and it turns them into an ICD-10 code, which is an international code for a cause of injury or death. It's a whole system of codes. What you have then is you have a single point of failure. If there's something wrong with the software, something wrong at the CDC, or something is done by the CDC, they can affect every state that sends their death certificates to them. And so far, I haven't found a state that does it on their own. Massachusetts sends them, Vermont sends them, Minnesota sends them to the CDC for coding, and Connecticut too. I probably shouldn't talk about that yet. Oops. Okay, so it goes to the CDC. The CDC the software automatically reads the words and applies a code. All right, and you know right here these codes were not applied. Let's move on. In March, a 77-year-old heart attack in a day, COVID vaccination on 2/27, felt sick after the vaccine. So 2/27, there's only 28 days in that year. Yep, in that year there were only 28 days in February. So we're talking 1, 2, 3 days. So in 3 days she was dead, but she felt sick immediately after. And the codes were not applied. Another one in March, a guy was, these are all Minnesotans, by the way, 65-year-old man, heart attack presumed in 2 weeks, presented to cardiology reporting chest pain, received the COVID vaccine on March 5th. Huh. All right. Well, he went to cardiology on the 11th. That's only 6 days. He was dead on the 17th. That's another 6 days. That's 12 days total, but the time to onset of symptoms was pretty quick, and it's a presumed heart attack. I'd say that's pretty causal or should be considered. It should be on the death certificate. It's not coded. March, 68-year-old, Minnesota. Heart attack in less than 4 hours. Adverse reaction. It says adverse reaction. That's important to know for later in this presentation. Less than 4 hours, had a heart attack, died. All right. The codes Y59 and T50 were applied by the CDC, and this is March 19. So they did apply. The software did work on this one. It's interesting to note. You have a 90-year-old COVID vaccine side effects. See, it's in this one, this prior one, see it says adverse reaction. This one says COVID vaccine side effects, not vaccination, vaccine. And this one says vaccination, adverse reaction to COVID-19 vaccination. All right, and the codes were applied to hers as well. Then on August 24, you have an 86-year-old ARDS due to COVID pneumonia in weeks, Moderna COVID-19 vaccine on 2/14 and 3/14. So you have a fully vaccinated guy, 5 months after a fully vaccination, he dies of COVID. And COVID's on his death certificate. There's no mention of the vaccine. It's not really, is it reported as a breakthrough? It's supposed to be reported to VAERS. I don't think it was reported to VAERS. But the prefixes Y59, T88, and T50 were not there. And lastly, you remember that whole talk about breakthrough infections? Remember they were trying to like con everybody? Oh, there was one breakthrough infection in like this corner of Nebraska somewhere or something. Yeah, right. Everybody was getting COVID. The news was lying to you, telling you, oh, it's a rare breakthrough infection. No, people were vaccinated got COVID more. Okay.
I think we've all seen that too, John. We used to do a survey before our meetings. And do you know someone that's vaccinated and also tested positive, so a breakthrough? And it got so ridiculous towards the end that we stopped doing it because people said, how many people know one person that's been vaccinated and it was a breakthrough? And everyone raised their hand. And we got to the point where people knew like 20 and 30 people that were breakthroughs. So we just stopped doing it because everyone knew people. It wasn't as rare as they told us. Yeah.
Well, what they didn't tell you is your outcome is going to be far worse. You're probably going to get like, shingles, RSV. You keep hearing about RSV. Why? Because you wrecked people's immune systems who've been carrying RSV around for 40 years or shingles around for 40 years. And you allowed it to replicate in a body that was otherwise safe from it. And then they can actually shed. And you talk about shedding. Well, you're not shedding the vaccine most of the cases. You're shedding a virus that was allowed to replicate because you destroyed your immune system with the COVID mRNA BS shot. All right, this one is kind of emotional for me. I don't know how many Minnesotans are on the phone or on the call here, but I really want to talk to this person. That stuff. He had 4 kids and beautiful kids and beautiful wife, and it seemed like he was a lawyer and he immigrated here from another continent and grew up in Providence, it's less than 45 minutes from me, or in the Rhode Island, and then went to law school, worked in the Bronx, and made his way to Minnesota. And was raising a family of young kids. And then, so here we go, 38-year-old, died in September 21. Somebody didn't input this into VAERS for 2 years. They waited 2 years to put it into VAERS. Obviously, I think it might have been a family member probably because of the emotional pain and probably realizing that doctors didn't put it in, which is their duty to do. And it's actually unlawful for them to have not put it in. So severe shoulder pain on his right side, his right shoulder, could not be touched on August 26th. Shortness of breath the next day. Chest pressure 2 days after that. Went to the ER the day after that. And then he wasn't able to speak on the phone, and whoever's writing this, he was talking to, and so that person's writing it. He took his last breath on the gurney on his front lawn. The circumstances of him ending up on his front lawn were not, it wasn't nice. The poor guy was just struggling to breathe. And he was taken to a local hospital 40 minutes away, pronounced DOA. While in the ER, we asked the nurse if she would be able to search the database to see if the patient had received one of the COVID immunizations. She attempted to, and after several attempts, said that his account had been locked. We found that a bit odd, as he had only died hours before. I believe he might have worked for the DA. I think he was a prosecutor, so that would be, working for some type of local or state government. We then called his employer, asked if it was mandated. The employer said it was voluntary, a personal choice, didn't have a record. But that patient told him he had been vaccinated. So the boss at work told the family that he had been vaccinated. His body went to the coroner. The autopsy came back as myocarditis. No pneumonia found. September 1st, 38-year-old. This is from here's the death certificate. Cardiac arrhythmia in minutes. Acute lymphocytic myocarditis involving his bundle, that's the bundle branch, and the ventricular septum near the right bundle branch. Okay. His specific white cells, lymphocytes, were attacking his myocardium of his heart. All right, that was a tough one. In 2021, yeah.
You talked about the long delay on getting reported to VAERS. So another thing that came out with our commissioner of health, I call her the commissioner of health, but anyway, she was the one I reported in the very beginning that had blood clot and was reported to VAERS. She admitted on a video that it took 2 years for her VAERS report to actually show up in VAERS. So it was submitted in 2021, and it finally showed up in, I believe, October of 2023. And so she actually said, and she's our commissioner of health, the former commissioner of health, it took, for her own VAERS report, took 2 years to get processed. And then I also want to just bring up the fact that the database of all the immunizations. So if for whatever reason, state of Minnesota, as soon as you die, and apparently from that example that you just showed us, like literally minutes after you die, the immunization database is locked. Because right now, Minnesota has any vaccines you've ever taken, I guess any kind of mainstream place is logged in the state of Minnesota's immunization database. And you can access it if you're a healthcare worker. We actually have healthcare workers in our group that can access that and see who's been injected with all the different vaccines. But as soon as that person dies, it's locked. And what you just showed us right there proves that. And kind of just backs it up, because we've been hearing that as soon as someone dies, you can no longer access that. Now, wouldn't that be interesting information to have? You'd think we'd wanted that information so we could see, is the vaccine actually preventing deaths? Is it helping prevent deaths at all? But it's interesting that, they almost like they don't want us to have that information. In fact, it seems like the United States has one of the worst. Some of the other countries have better reporting as far as, the vaccine deaths and vaccine injuries and stuff like that. For whatever reason, it's not in the CDC and the Minnesota Department of Health's best interest to be transparent with some of those pieces of data.
John, do they do that in Massachusetts too? Do they lock the vaccine record after a person dies?
I don't know if they lock it, but let me comment on this because it's important. I found this over a year and a half ago. I made a proposal. So all the states have a vaccine registry. In Massachusetts, it's called the Massachusetts Immunization Information System. In New Hampshire, the New Hampshire Immunization Information System. The national one where they all funnel up to is called the Immunization Information System. California's is called California something. It's called CHIRP. No, that's Indiana. Hoosiers something. CHIRP. California is CARES. California Immunization Registry, CAIR. So every state has one. All that it would take is correlating the immunization registry to vital records or Medicare, Medicaid, or whatever public health databases there are for both the living and the dead. It would all be over. I know that. I proposed that over a year and a half ago. In fact, I wrote a bill, HB 1661, for New Hampshire. And there were issues with it, so it got tabled by the House leadership. Now, the only issue that anybody had that was brought up by the single person who was also in leadership, who said that there's issues, but when asked what issues, she had nothing to say. Her only question was, is there a provision for pharma to get that data too? Now, what my bill is that, number one, anybody who's had an immunization within the 2 years prior to death, it should be written on the death certificate what that immunization was, when it was given, okay, and what lots and stuff like that it was. Number two, the state every quarter should be required to provide how many people died within 1 day, 3 days, 1 week, 3 weeks, 10 weeks, 25 weeks, and 1 year of any immunization. And have it rolling every quarter, how many people died within so many days or weeks or months of vaccination. Number three is biennial, or every 2 year, provide a health report of the state and basically do the analysis that I've done as one guy with a computer. The state should do an analysis of all the causes of death and genders and put them out by individual ICD-10 code. All individual, it's just a massive amount of data that can be done, automated, and put out every 2 years, biennially. And the fourth thing is the most important one in that bill, and that is anybody can submit a proposal to audit the state's public health data, but the proposals have to be competent. You have to be able to, it's telling what you're going to produce and what you're going to do when you come in. And of all the ones that are not, Yahoo's just trying to say, they got to have some competence. They cannot be in pharma. They cannot be in government. And out of all the ones who submit proposals that are qualified, 4 are selected by random lottery. And then they get to come into the state offices for a month and use the computers and evaluate the state's public health data. Now, there's one other state that took this bill verbatim and submitted it. Do you know a guy named Shane Meckland? He submitted it to Minnesota. So you have that bill submitted. I don't think it's going to go anywhere because there's a bunch of Democrats there, but yeah. So there's another state that I won't say because he ran out of time. He couldn't submit it. But now people all around, Steve Kirsch is also on the track to proposing bills to do this. There are nuances to my bill. Well, it's a bill, but submitted to multiple places. And that nuance is the management tricks. If you get an MBA, if you study management and how to reset a corporate culture or reset an office culture, that's built within the bill. I'm not going to explain all the details in it. It's not just getting data to the public. It's not just transparency. Yeah. So getting back to your question, though, let's see. I think I answered it.
Right. John, can I ask one quick question? In the previous case, we were talking about the young fellow that passed away. He was having trouble. He perceived that he was having trouble getting breath, but what was really happening was his heart was failing. And it gave the impression of him having a breathing problem, but he really had a circulatory and heart, collapse. It wasn't a lung-related thing.
Correct, and that's pretty common, gotcha. Especially with pulmonary emboly. In fact, there's been a lot of misdiagnoses of pneumonia where people didn't have pneumonia. The problem was on the other side of their lung in the blood system. Sometimes you get, even with rouleau formation, where your red blood cells are stacking up like poker chips. What that does is it reduces the surface area of your red blood cells, which carry carry oxygen. And if you reduce all the surface area, then you can't carry enough oxygen in your red cells, and you're going to be labored breathing. There are different things that are happening with the blood that are making people think that their breathing is a problem of the lungs, but it's really, I can't get enough air. My brain's telling me I can't get enough air, but you're getting enough air. It's just not getting, it's not being, not enough is being carried by your blood.
We also had a lot of reports of people that would present to the hospital with heart failure, and they would test them for COVID, find a positive result, and then declare it was COVID, and they would treat them for quote treat them for COVID and finish them off.
Absolutely, yeah. I'm not going to get too deeply into midazolam, lorazepam, fentanyl, dexmedetomidine, propofol. Crash their breathing, put them on a ventilator, get a lung infection, put them on vancomycin, kill their kidneys, and they're dead. And that's all after they hit them with remdesivir and baricitinib to begin with, so they can get their money. And if you look at when that stuff kicked in, I'll show you a couple slides later of when exactly it kicked in was not when the EUAs came in, because after the EUAs came in, the money kicked in, right? When the money kicked in, that's when the behavior of killing people with these drugs started.
Was there compensation for giving people? We know for remdesivir, but what was the other drug you mentioned?
Baricitinib, Baricitinib, lots of I's. And it's on the same CMS.gov page. If you Google or DuckDuckGo, I got to stop using Google as a verb. I never use Google. It's a communist company. If you DuckDuckGo search NCTAP on CMS.gov for Veklury or Olumiant, that is remdesivir and baricitinib.
So they financially incentivize that drug as well.
Absolutely, yeah. 20% of the overall bill. If somebody was in the ICU, it cost $1 million. They get an extra $200,000 for running remdesivir through their veins.
And then the other drug as well, they would get
baricitinib too. Yeah.
And what's that drug? We know what remdesivir is supposedly supposed to do, but what is that other drug supposed to do?
I don't know.
We don't even know. Wow.
I'm not a doctor. I can tell you the facts, right? But
what do they claim? What was their? Do you know what their logic was for even administering?
I forget baricitinib and what it's for. I forget.
Gotcha. Sure.
But if you scroll down, you'll see a bunch of dates. It won't be the ones I'm saying. But if you go down to the bottom, you'll see November 2nd. That's the date you need to look for.
Which
November
year?
2nd. 2020.
2020.
Yeah, 2020. Yep. So in mid-December, actually by the end of November, acute renal failure deaths started taking off. That's when they took off.
And we find this at cms.gov.
Yep.
/
well, just DuckDuckGo, because I'm not sure the exact thing, but if you do CMS NCTAP.
MTCAP.
Nope. N as in November. November,
okay.
Charlie Alpha. November, Charlie Tango Alpha. What's P?
Peter.
It's not Peter.
NTCAP. NTCAP. And do you happen to know what that acronym stands for?
National something accounting, national code. I can't remember.
Gotcha. But
accounting, national COVID accounting.
And the function of the page is to talk about the incentivization?
Something payment. The P is payment. It's talking about all the extra money you get.
Gotcha. New COVID-19 treatments add-on payment, NCTAP.
That's
what
it.
it stands for.
That's it. He's got it.
Wow.
That's a golden page for understanding.
Yeah, it is. Yeah. Well, every lawyer that's got a lawsuit in this should know about that.
Hey, are you going to that big conference of lawyers out in, I don't know where the heck it is?
I'm going.
Good.
I just found out I'm going. Somebody told me I had to go, and they're paying for. I got somebody to pay for a room, and I got somebody to pay for the Steve Kirsch's organization picked up the tab for me to go.
There's two. You realize there's two legal conferences, right?
Yeah, I know. I talked to Warner. Yeah.
Okay.
I know all these guys.
Okay.
They all know me.
One is going to be more successful than the other.
Well, I mean, what's success? One is
Uh,
being put on by
Lots of people, lots of relevant attorneys all in one place at the same time.
well, one is a for-profit company putting on a show for lawyers. The other one is lawyers want to get together and talk about real cases. And that's not to slight either one, but the Colorado one's going to be good too. I wish I could go to that one, but I'm not a lawyer. For everybody
Which is the
listening,
one? Who's putting on the Colorado one?
I don't know who's
That's
putting it
Warner?
on, but Warner's involved. Warner Mendenhall.
So that's Warner's event.
I think it is. Yeah.
Okay.
I don't want to.
I don't mean to take us off track, but what do you know when that one is? Because that's a good one for you to go to if you can, and I'll try to help you if I can.
I don't know when that is. I've got so much on my plate right now. I didn't even plan to go to the one in Vegas, but now I'm going to Vegas next week.
Gotcha.
Yeah. I shouldn't tell everybody that. I have a very large son. He's going to be home taking care of the house, so nobody should rob my house when I'm gone. You'll get hurt. All right. I get so much in my head. I could talk for 4 hours straight. But let me get through the presentation. I think people want to see the Minnesota data. So out of the 49 Minnesota death records contain VA-CCIN in Part 1 or Part 2. And all this is from the CDC memorandum, by the way. I was cutting and pasting from it to build this presentation. 38 of the 49 are situated in the context of unvaccinated or not vaccinated. Okay, so out of those 49, of the 11 left, 9 are situated in the context of COVID immunization as a cause or contributing factor in death. So you have 9 death certificates in Minnesota that actually implicate the vaccination or gene therapy drug that never should have been put in arms. So then there's one that says incomplete vaccination. That's just in 21. And then in 22, 34 say vaccine. I do a string search, right? So I'm looking for characters in a row because I want vaccinated or vaccination or vaccine. I want to capture them all. And unfortunately, it also captures unvaccinated. So I'm subtracting those. There's 23. 4 are in the context of immunization as a cause or contributing factor. Those are the important ones. So 9 and 4 is 13. One was a breakthrough. 3 mentioned breakthrough. 2 are incomplete or inadequate COVID immunization. So I guess somebody got 1 shot, they didn't get 2, so they call it incomplete or inadequate, whatever. All right. This is an interesting one. This is how I correlate. Now, I'm gonna blow through this. January 14, 2022, 37-year-old man injected. It was entered into the system on January 24 in VAERS. So that's 10 days later. His onset of symptoms are said to be January 19. That's 5 days after injection date. He died on January 20. That's 6 days after injection. 1 day after onset, and 4 days before the record was input into the system. Received his booster shot on 1/14/2022. On the evening, he had a massive fever, loss of appetite, inability to sleep, lingering headache the next day, loss of appetite, forced himself to eat, started vomiting on 1/16. That's 2 days after vaccination. Constantly vomiting from midnight to 5 p.m. So 17 hours. Estimated vomited 8 times, literally nothing left. Said he didn't really eat or sleep well on the 16th. That's 2 days after. On the 17th, reported shortness of breath. Heart was beating quite fast, so had tachycardia likely. I'm just going to skip. Okay. He was scheduled to teach a virtual class at a local college on 1/18. He did not attend. He was found deceased in his apartment on 1/20. So they called him as dead on 1/20. But he might have been dead. He didn't even show up to teach the class on 1/18. It could have been 4 days. It could have been 3 days after the vaccine that he died. I mean, I'm sure they can estimate that maybe he was still warm. I mean, I'm sure they're close to it. But anyway, now let's talk about the death certificates. There's only one 37-year-old man known to have died in Minnesota on January 20th, 2022. 37 years old. Death record share file number, I have it there. Part 1 of his death record states ketoacidosis. Part 2 is empty. That's it. Nothing else. Just ketoacidosis. And there was only one ICD-10 code applied, E87.2, which means acidosis. All codes to Jerome's death certificate are E872. The CDC's duty is now the duty of named agents to verify. That's the stuff I wrote for the CDC and FDA. All right. The decedent occupation field in his death record states class lecturer. And the symptom text states was scheduled to teach a virtual class at a local college. Remember that from VAERS. Okay, so we know he was scheduled to teach a class, and the death certificate says he's a class lecturer. He's the same age, he's male, and he died on the same day. I think I got the right guy. Okay, it has to be, right? So you have a vaccine death that was not labeled a vaccine death, and they darn well know why he died. And they avoided writing probably the true cause of death. They just wrote ketoacidosis. You know, what happened to him? Did he have a stroke? Did he have a pulmonary embolism? They avoided putting anything else on the death certificate. I believe this is criminal behavior. All right, 65-year-old man, immunization according to these are VAERS correlations that I'm doing. Onset date was February 22nd. Injected on the 10th. Coronary artery disease, elevated PSA, coronary artery disease, hypertension, atrial fibrillation, morbid obesity, and hyperlipidemia. Those are all in the VAERS report. And then I find a death certificate of a 65-year-old man recorded as having died on February 22nd. Same date, same guy, same age, same gender. Death record part 1. Myocardial infarction, coronary artery disease, hypertension, morbid obesity, hyperlipidemia, atrial fibrillation, and elevated PSA, hyperlipidemia. I think I got the right guy. It's almost as if somebody took the death record and wrote it into VAERS.
Hey, John,
so that's
does VAERS tell you what state the person is who had the adverse?
Yeah, usually. Yeah, it depends on if the person put it in, and most of the people put it in, some don't. And it's really annoying when they don't because they're
so
useless.
So basically, you start with VAERS, you get a profile of somebody, and then if you know the state, you go to your death records of Minnesota and then say, okay, anybody this age, this date, this profession.
Yeah, well, my investigation process is to first, if I've got a Minnesota death record database, then I go to VAERS and I first sort on Minnesota, and I look under died. There's a column with died, and I look for if it's a Y in that column, I filter those. When I'm done with those, then, go ahead.
So you're focusing entirely on deaths only.
Initially, because there are plenty of reports, like in Massachusetts, a 7-year-old girl and a 17-year-old girl. Their VAERS reports were made before they died, and there's no way to go in and update a VAERS report to say that somebody has died. It's a big flaw in the system. They know it's there. It's there likely on purpose to not show that somebody died. So I do look for others after I do the low-hanging fruit, which is died.
Gotcha.
I just found in the last 2 days, I have a new database. I found 34 vaccine deaths in a single state. This was not coded as vaccine death. These are all fraud. They're lying to everybody. All right. Now, I told you earlier to key in on certain phrases for the ones that were coded. I have a mute button on my mic. That's what I press when I cough. So what did the CDC know, and when did they know it? On July 3rd, Aaron Hertzberg published in the Brownstone Institute. CDC, this is the title, CDC altered Minnesota death certificates that list a COVID vaccine as a cause of death. And I have a reference there. It's all referenced in the book, in the CDC memorandum. All right, here's an excerpt. In almost every death certificate that identifies COVID vaccine as a cause of death, the CDC committed data fraud by not assigning the ICD-10 code for vaccine side effects to the causes of death listed on the death certificate. July 3rd, okay? On July 5th, 2 days later, Greg Piper from Just the News sent an email to media at CDC, so their public relations group. The body of the email stated, "Hello, this is Greg Piper at Just the News in DC. I want to get the agency's response on this reported discovery about your categorization of Minnesota death certificates." Now, the reason this is important, this went viral to millions of people. This was picked up. It was a big story last July. On July 6th, okay, so that's one day. So he wrote it at 9:12 p.m. And at 10:46 a.m., Kristen Nordland of CDC Public Affairs replied to Greg Piper of Just the News. I'll read, this is from the CDC memorandum. The response email from Nordland is an unintelligible word salad, seemingly debating the difference between the word vaccine and the word vaccination. The email appears to be an attempt to misinform, disinform, and outright prevaricate, expressing that there is no unusual pattern of illness or death resulting from COVID immunizations. Here's the body of the email Nordland sent to Piper. Hi, Greg. Thanks for reaching out to the CDC. The claim in the post is incorrect. The ICD-10 codes in question pertain to adverse effects of vaccines, not vaccination. Vaccination is not a disease or cause of death, so simple mention of the vaccine or vaccination without mention of adverse effects will not get coded. The examples in the article for which adverse effects codes are included are those that mention adverse or side effects of the vaccine. The examples for which the codes are not included do not contain such language. So you remember I told you it said adverse effect of? But that said vaccination, not vaccine. The next one said vaccine, and it said side effect of vaccine. So what she did is she went through the 3 that were coded in Minnesota, and she tailored her excuse around those 3. All right? COVID vaccines are undergoing the most intense safety monitoring in U.S. history. I can't read the rest because my keyboard has to function, and I don't want to throw up on it. So let me go on. I'm not going to read the rest of this, but here's what you should know. 9 Minnesota death records mentioned vaccine or vaccination. Only 3 were coded, right? Kristen basically tailored her excuse around the 3 Minnesota death certificates. So vaccine, not vaccination, has to say side effect of, adverse effect of. Meet Solomon from Massachusetts, 60 years old, died January 16, 2021. Acute bronchopneumonia and idiopathic thrombocytopenia following COVID-19 vaccination in days. It doesn't say side effect of. It doesn't say adverse effect of. It doesn't say vaccine, it says vaccination. And yes, his record was coded with Y590 and T881, making her excuse utter lies and fraud on top of the other lies and fraud at the CDC. The really important thing here is that this is an automatic software program. For them not to have coded, they coded this one for Solomon, January 16, and then another 8 they didn't. Somebody is manually intervening to either turn off the software to code vaccines as a cause of death, or they're deleting them. It has to be. This is automatic. Computers don't make these decisions. They do what they're told to do. If they coded 3 in Minnesota and they coded 1 in Massachusetts, and then they didn't code the rest after that, then somebody is manually intervening to delete vaccine codes. Y59 is the key one. You don't even have to think about T88. Y59 is the key one that they know they're supposed to use. So the CDC is committing massive amounts of fraud by hiding codes that can be tracked as causes of death for the vaccine.
So John, if I could just ask a question. So the CDC is keeping the ultimate record of national deaths. Yeah.
Well, all the states have their own. They send them to the CDC. The CDC does keep overall. But what they do is they have software to apply the codes to the English words that are sent to them on the death certificates. The codes are applied by the CDC. You have a single point of failure or a single point of fraudulent behavior. which leads to the deaths of 1 million Americans.
So the states are sending them the death certificates with whatever's on them, and
They
they have
send
a
them an
software,
electronic,
and they have a software program that's supposed to read them and supposed to automatically code them. And you're finding many cases where a death record that should have been coded as a vaccine death is just not coded inexplicably.
Even where the medical examiner or physician attending at time of death who filled out the death certificate, even in those records where they say the person died in 5 hours, the person died in 5 minutes, the person died the next day, pulmonary embolism, cardiac arrhythmia, myocarditis, even when it says it on the death certificate, there's no Y59.
And Y59 is?
Viral vaccines. Death from viral vaccines.
Viral vaccines.
Yeah.
And that's what the mRNA is considered, a viral vaccine?
It can be. Or T881, other complications following immunization not elsewhere classified. You don't have to, like people say, there are no codes. At the first COVID litigators conference, had a bunch of lawyers stand up, like 2 or 3 of them in their presentations. We need codes for the COVID vaccine as a cause of death. There are no codes. And it's like, that's why it's got, like, they're all wrong. I said they were all wrong when I was there. They don't know what they're talking about. Sorry, but they were wrong. Because I told you about pneumonia unspecified. If you don't know the exact, J15.3 streptococcal pneumonia or, staphylococcus pneumonia, the J15. Whatever, you can use J18.9 pneumonia unspecified. They do it all the time. You have these generic codes, and then you have the specific ones, and they could use an immunization code. They have plenty of codes to use. There's no excuse for not using a code where it says vaccination or vaccine on the death certificate, or the death record, I should say. They're electronic records. So yeah, the CDC has been committing massive amounts of fraud.
So the state record in some case has it right in the death record. It goes through this software processing, and somehow when it comes out the other end, the vaccine injury is not recorded.
I'm willing to bet that it comes out with a Y59 on it, and that somebody deletes it. I would bet that.
Gotcha.
Now, how do we find out? Well, let's get their software and run some death certificates through it and see what happens. Oh, you can't have it. Yeah. We can't catch you because, well, who's going to prosecute them for murder anyway? They have a monopoly on criminal prosecution. All right, what do we got? 9:30? I gotta go fast. You guys okay with me going really fast? All right.
Oh yeah.
So what is Kristen telling you? She lied on top of the fraud of omission by the CDC. She tailored her excuse, lie upon lie, hid, obfuscate, obscure, camouflage COVID gene therapy drug deaths. This is not a small crime. These are federal felonies, 5 to 20 years. I told you 18 U.S.C. 1035, 1040, 1343. Now let's get into the Minnesota data. All-cause COVID and pneumonia, one of each on here. There were 14,150 excess all-cause deaths in the 3 years of 20, 21, and 22. There were 14,335 purported COVID deaths in those 3 years. Those match pretty good. Minnesota's not committing the data fraud that Massachusetts is. Massachusetts is off by 5,500. They lied by 5,500, and there's no way they could have had that many COVID deaths. I showed you at the very beginning Massachusetts was the center of the whole pharma industry. Well, oh, gee, why would they have purported the most? It just so happens that a virus starts halfway around the world in China. And yet the 3 states that have the most to gain, New York, New Jersey, and Massachusetts, purported the most deaths, not by a little, but Massachusetts being third of those 3 was 50% more than Belgium. That's not even close to us, right? The fourth one was Belgium. I mean, Massachusetts, Minnesota, and New York. Well, what about, Maine, New Hampshire, Rhode Island, Vermont? How come they didn't get on the bandwagon to get all that federal money to put COVID down? All right, so these are, and then pneumonia was 3,000 excess. This is J18, so it's a pneumonia unspecified. It's not even J18.9. It's all at .0, 1, and 9. All right. Should I explain this one? Well, if you subtract the COVID deaths, from the all-cause deaths, you get this dotted line here. And the trending is this black line is all-cause deaths and the gray line is COVID. Now, the COVID matches up it matches up perfectly, except for this last wave, not so much. But what's normal is in this band of dashed lines. It's a little bit high in 2017-18. It was a bad like flu year, right? And it's going along, and you'd expect it to go down and back up to the peak, but it never went up. So all these deaths that are missing up here is where some COVID overcounting happened. So I said the numbers added up before, but it appears I show many different views in graphs. You can't find anything through one view. You have to have multiple views. And I found that there's some shenanigans going on here, because this should come up to the dashed line back down. It does go up the next year. It doesn't appear as though there's any shenanigans there. And here, not much. But this year, this 2020 to 2021 year, and in the summer, something's really wrong there. It looks like there was some shenanigans with the data. All right. All-cause COVID and pneumonia. I show you that the peaks line up in every single one. This is the first peak, the first COVID wave in Minnesota is nothing like Massachusetts. Nothing. You had a small wave at first, and then your second one was really big, and then a little bit smaller in the next one, and really small in the fourth wave, right? Blood and blood forming. So I'm going to read these. Don't even try to look at them. The arrows are showing you what happened from 2020 to 2021. Does it go up or down from 2020 to 2021? So all cause went down, right? COVID went down, but decodes, which are blood and blood forming, went up. I wonder why that is. Now the 85 plus group, which a lot of the dry tinder was wiped out during the COVID wave, right? The first two COVID waves. So you would expect 85 pluses to go down anyway. But then what's interesting is every single other age group went up and up and up and up and up. How does that make any sense? If all-cause deaths go down, COVID deaths go down, why are blood and blood-forming organ deaths going up? Because there's a problem.
Can you just explain what a blood and blood-forming death is? What would be an example of that?
Yeah. So those are all D codes, anything beginning with D. And that could be acute post-hemorrhagic anemia, thrombocytopenia. It could be any type of like hyperkalemia. What am I missing? There's a lot of immune mechanisms.
Those are blood disorders, not heart disorders.
Yeah. It has to do with the blood. Yeah. So you've got something wrong with the blood. There's hyperkalemia is too much potassium.
So suddenly there was a spike of blood disorders.
Yes. Yep.
Gotcha.
Yeah, it's all about the blood. Vaccine's all about the blood. I mean, circulatory manifests because the blood system is attacking your organs. There's dysregulation of both white cells created in the marrow and the lymph, as well as erythrocytes, red cells created mostly in the marrow. And your platelets, your thrombocytes are also created in the marrow. All three are dysregulated. It's either putting out too much or too little. You're either clotting or bleeding. And you also can't fight infections, and you're fighting your own organs. You have autoimmune issues, and people say, well, these can't all be from the vaccine. Sure they can, because it's really like one or two different mechanisms of action are occurring, but it's systemic because your blood goes everywhere. And so your body can attack itself at any given organ.
And then could I ask you to go back and just show people the extreme nature of that increase of blood diseases? Because
I'm going to show you the extreme ones.
Okay, great. Sorry. Okay, good.
Yeah. So this is D8, and this is the immune mechanism. So remember I said white cells, they call it the immune mechanism. It makes white cells, your lymph and your marrow. Look at this. Just look at this thing go sky high. Now the one on the right, what I do is I divide by the total number of deaths. I divide by the total number of deaths. The reason for that is there were so many excess deaths in 2020 from call it COVID if you want. But what that did is it carried with it a lot of people didn't just die of COVID. They died of they had blood clots and all these things were written down. And so everything went high. If you divide by the total number of deaths, you get what is the propensity of that as a percentage of all deaths. And it shows that 2020 actually drops below 2017. So right here, 2020 as a raw number is much higher than 2017. But if you divide by total number of deaths in a year, you get a better visual of what's really happening and when. And it's really happening middle of 21 to 22. It just went sky high. And this is an extra 113 deaths.
After the vaccinations rolled out.
Yep, after vaccination, extra 113. It's up 34% in 21 and 61% in 22. Now I've got a whole bunch of these. Let's start flying through. And looking at that same D8 disorders involving the immune mechanism, I show you another view where 2020, you see this dashed line, it doesn't actually separate until the very end, and it's not separated by very much. Now, the other gray lines here are 2015 through 19. So it could be like 2015, 16, 17, 18, 19, 2020, and then boom, 21 way up there. And then 22 is just ridiculously high. And then in this one on the right, again, another view. Since most stuff happens in the winter, and if you were to add the first COVID wave that happened not in 2019, but in the beginning of 2020, you also have half of the second wave in the 2020-2021 winter. So now you're taking a full wave of one and a half wave of the other. Your annual calendar year graphs start to look wacky. Now, if I start a graph on July 1st and do a fiscal year, this is what you get. This is what you get here. And so that's 2019, 2020, and then second half of 2020 and first half of 21. These are acute issues. These are issues that suddenly happen after vaccination. This is not a long-term cancer thing. These things happen shortly after vaccination. So you would expect to see a lot in the first half of 21, and there it is. And you just see how steep this curve is. This is not normal. And you also see that the first wave of COVID right here in the first blue arrow, there's no correlation. The black line is the D8s, the immune mechanism, and then you have the gray line, which is COVID. There's no correlation. There is correlation in the next two. You can kind of see it. It's a little bit maybe delayed. There's no correlation here in later. People are still getting boosters and dying, but it's nothing to do with COVID. So clearly there's a major issue. These are 113 extra souls gone from the planet. Now, pulmonary embolism, 428. 428 extra deaths. Now, does it happen with COVID? It might, but I think a lot of old people were not walked down the hall twice a day. They didn't bear weight on their legs and their calf muscles, and so they got pulmonary emboli lying in bed because the staff didn't show up because they were afraid of COVID. Yeah, it's a long sentence I just said, and it's an excuse, but I think it's
we got plenty of eyewitness testimony that once you were declared COVID, you were put in bed and you were given no medical services, nothing.
Yeah, and they killed them because if you're 90 years old and you don't bear weight on your legs and contract your calves, the blood's going to pool in your legs. You're going to get a clot. You're going to throw the clot to be a pulmonary embolism. You're going to die. And that's what this is. Now, when you divide by the total number of deaths, you see this progression here. 2020 kind of falls in line. But there's a jump, and this jump causes a lot of extra people to die. All right. This is the fiscal year. You also see that it goes nuts. And this one is not that far off. So it wasn't that many in 2020. It's just that a lot of extra people died in 2020. So that first graph shows, oh, there was extra pulmonary embolism deaths. Yeah, it's because there were extra deaths from a lot of things. And it just carried pulmonary embolism with it. You see this band even through 2020. At the end of 2020, it jumps up. But then this just goes nuts. I mean, it's like you see how big that is. That's, it begins 9 months into the vaccination period. This is after people were getting their boosters. Aortic dissections, you get a hole blown through your aorta, probably because you took a venous hit, like Mark Girardeau says, a bolus injection. So if the tip of the needle is near a vein or if it's near a vein, it's going to go back and then might go out to your aorta at some point, and the blood doesn't flow through your veins at a constant rate. When it gets closer to the heart, it goes and stops and goes and stops because your heart's beating, right? It pushes. When it pushes, everything behind stops, and then it sucks in more and pushes. It's a pump, but it's not a continuous pump. It's a boom, boom, boom. And so the LNPs are little fat bubbles, right, that contain the mRNA. And it's a fluid dynamics problem to find out where they go, especially when they go around a curve. You know what? I'm getting too engineering here. Sorry. I'll stop.
But that's John. That's an ingredient in the mRNA vaccine that you just described.
Yeah. Not just an ingredient. It's required to get it into your cells. You can't get the mRNA into a cell, and therefore it'd be useless. Well, it's already useless, but well, it's useful if you want to kill people. But okay, the mRNA is in the lipid nanoparticle, and it can't get into your cell unless it mimics the outside of a cell. Also has lipids on it, and it says, "Let me in. I'm you. I'm the same as you." And your cell is like, "Okay, come on in, because you're a little lipid, and I'm going to suck you in." And once it gets into the cell, then it opens up, decays or whatever, and the mRNA then floats out, and your ribosomes, it attaches to some other thing, and then it grabs the ribosomes and starts generating spike proteins, and other proteins because of all the contaminants in it. But I don't want to deviate too much, and I'm not a scientist. So.
Gotcha. But the point is, there's things in those injections that can cause physical damage.
Oh yeah. Yeah, as soon as your cell is transfected, if you're the type of person to react to it, your cell is going to call to be killed, and the T cells are going to come and attack, and that's what's happening here in this aortic dissection. It's attacking the endothelial cells, the inside lining of your blood vessel, in a single area. So what I was talking about fluid dynamics, if they all end up in one place, they transfect the cells, right? In one place, and you can make enough of them, the T cells attack, and you've eaten a hole through the endothelium of your aorta, and then you get an aneurysm, and then it ruptures, and you bleed out. And so you have a spike. You see this obvious spike in aortic dissections. That was a long way around. I'm glad you asked the question because it helped me explain it to people. Arterial thrombosis, so clots in your arteries, not your veins. You see in 2022 with all the boosters that there's an extra 43 people who died. We can look at more views. You see that it's higher. This is the cumulative throughout the year, and you see where the spikes are. So the black line is 2022. Why is it up above, like normal would be down here in the summer? This makes sense at the end of the year. A lot more people die, older people, but you shouldn't have this many clots in your arteries. Now let's look at veins. I added some graphics for you guys to make it fun because I do everything in black and white usually. All right. Do I have to say anything? I mean, can you see what's happening in 21 and 22 that did not happen really in 2020 that much?
And I think everybody knows this, but in each one of these sets of bars, it's the last two bars to the right is one's 21 and the other one's 22. So right. Yeah, it's pretty dramatic.
The last two bars are the vaccine years, and the bar before that was the COVID year without the vaccines. And you have a progression upward, but not that much. It's an extra 47 people. 47 people are dead. And then I use the fiscal year, and you can see that it's ongoing through 2023. And I can't believe they all came out to 85. That was, there's weird number patterns that show up when you do enough of this. Lymph vessels and nodes. Again, the right two bars, astronomically high, 33 extra people. And you see 2020, when you adjust for, and don't worry about the numbers on the top of the bars. It's automatically generated. There's not enough unit precision. I couldn't fit enough precision on the top of the bars. So you'll see that they both say 10, but one's bigger than the other, or 0.10, I should say.
And material that is introduced to the blood, some of it will end up in the lymph eventually.
Oh yeah, yeah. So even if you do take a deltoid injection in the muscle, it's going to end up in your lymph node under your armpit. It's because it's all the stuff drains there. You're absolutely right. Now, when I did a fiscal year, look what happened. Look at this spike. It's crazy how many. There's nobody in the world who's done this like I've done it, and I've known this stuff for 2 years. I'm just getting out there now. The books are coming out, but all the scientists have been kind of in the way. They're looking at it with statistical methods and epidemiological methods, and I'm an engineer. These are raw numbers. I'm not fudging these. You're seeing what is killing people, the symptom spectrum profile of death of a society. I don't even have time to do the ages, but the age spectrum profile, the age has dropped like 16 years in Massachusetts, the age of excess death. That's unheard of. All right, so lymph and lymph vessels. I put these guardrails around it so you can see. I do peaks and troughs. It's like, it's the same for all these years, including the first wave of COVID's like right here. And then it's still within it. At the end of the year, before the shots, there was a spike. But then the troughs started lifting off. It's impossible. Some externality has entered society and killed a lot of people. All right, nerve and nerve root. These are G codes. They have to do with your nervous system. You see 21 and 22 are very high, an extra 14 people. Hydrocephalus. I mean, that's crazy high, right? An extra 30.
Brain swelling? That's
Yep.
brain swelling?
Yes. Water. It's not just swelling. It's some, I don't know. I looked it up before. I forget a lot of these. And here's another lazy category: disorder of the brain unspecified. So you have them not putting it in for maybe stroke or something, and like, throw it into that category. But look at the one on the right here. It just shows you. It just takes off like crazy.
And the dark line is 2022.
That's correct.
The one that's shooting the moon.
Yep. Dashed is 2020, and the dotted line is 21. And the dotted and dashed end up pretty close to each other. But these were carried by a lot of extra people who died, don't forget. Did I do the percentage? No, I didn't. So these are other diseases of the spinal cord. The spinal cord is getting attacked too. All right, cancers. In Minnesota, bone and articular cartilage cancer. In Massachusetts, it was bone and bone marrow cancer. And I'm convinced that the words that are written on the death certificates are probably the same exact cancers that are happening in both states from the vaccine, but the way they write it in the Massachusetts is the different custom and practice of how they write it in Minnesota. And when it goes to the CDC, it gets coded completely different. One is bone and articular cartilage. The articular is missing here, but there it is right there, bone and articular cartilage. But in Massachusetts, it's bone and bone marrow cancer, which is C7-7, completely different. But you just see how high it is here. Malignant neoplasm without specification of site. Now this is progressing, and then there's a deficit, and then the line comes and it hits right here. Now it doesn't seem like a lot visually, but that goes from 700 to 810. That's like 88 extra people. That's a lot of people. And I give you another view. Look to the right here. You see the year of 2020 is right among 2015 through 19. And 2021 was even among 2015 through 19.
And this is cumulative for the year, so that's why it's going up. But it's going up at a much higher rate for 2022.
Correct. It's if you take the first derivative of this, you get the daily. So you're right. It's cumulative. 88 extra people. Follicular lymphoma. You have a progression, and then boom, you have an extra 10 people. And if I divide by the number of total deaths, you see how this just sticks out like a sore thumb. And if you look at another view here on the right, the black is again way high. Acute myeloblastic leukemia, malignant neoplasm of Oh, these are, so hematopoietic cells are blood stem cells. So a hematopoietic cell can turn into a red cell, a white cell, or a platelet. And it depends on where it goes and what it's what it's needed to be. And the numbers are very small, but even with the small numbers, you see an issue here. You see a problem. This is not normal. Something is causing a dysregulation of the blood and blood components.
So this is normally a super rare blood cancer, but suddenly it exploded for 2022.
Yeah, I mean, I would say it exploded. It's 3 times normal. Yeah.
Or 6 times if you go back to 2019
Yeah.
on the right-hand chart. Yeah, wow. Yeah,
Yeah,
people
this,
should know it's a small thing, but from 1 to 6 may not seem like a big deal, but if you look at it percentage-wise, it's 500%. If you could get 500% on your money every year, you'd be Bill Gates in about 20 years.
and it's going in the wrong direction. So what do you think is going to happen in the next year? Independent multiple sites. Again, 2022, off the charts. Acute renal failure. Let's do acute renal failure and before I wrap it up. Wow, been on for a long time. Well, acute renal failure is 1,600 excess deaths in Minnesota. What do I have here? 18, 19. Oh, this is Massachusetts. Sorry. I'm showing you Massachusetts for a reason. I want you to look at the shape of the graph and see how much this went up. This is 2,000 extra deaths in Massachusetts in the last 2 years. And this dashed line, you probably can't see it because it's so small, but here you have this big wave here in this dashed line in 2020. That's the first COVID wave. Everything went up. Pulmonary embolism, everything went up because 8,800 excess deaths did occur in Massachusetts with an average age of 81.3. Now that carried a lot of codes with them, but then it goes down into normal. And then December 1st, it takes off. You remember November 2nd was that CMS.gov remdesivir and baricitinib 20% payout. And then you see this dashed line go up, and where does it end up? The dashed line turns into a dotted line on the other side right here, stays high, and it does go down a little bit, but it stays elevated the entire year, the whole year. Even in the summer, it's above the gray lines. And then it's up. And then you see what happens in 22 is just crazy. And you do have the seasonality. You do have the winter because more COVID happens in the winter, so more COVID diagnoses and remdesivir and hospital murders happen in the winter. And now let's go to Minnesota. Did the same thing happen in Minnesota? Well, yes, it did. In fact, 2020 didn't have that much extra. It was right in line. It says 104 excess because that's calculated based on these numbers, but when you divide by the total number of deaths, 2020 disappears into normal right there. The only two are 21 and 22. So it's not COVID.
And just to remind everybody, November 2020 is when they incentivized remdesivir. So
Yep.
the tail end of 2020. So you wouldn't necessarily see the numbers until 2021.
Yep. You see, maybe this 104 is that at the very end of the year. Maybe you're right about that. But this is, to put this in context, this I showed you Massachusetts and I showed you Minnesota. I also have 2 other states, same thing. That's 4 states. I have 5% of the population of the United States that show the exact same thing. And this extrapolates to more than 100,000 excess deaths by a single cause of death being acute kidney injury, acute renal failure, whatever you want to call it. That is the biggest single epidemic since the Spanish flu of 1918, 1919 for a single cause of death. There's nothing that kills with a single cause of death like this. And yet, they're not even studying it. The CDC isn't even mentioning renal failure as a big cause. Dialysis is going through the roof. Those dialysis machines, they're making tons of money selling those things. They got people going to clinics all the time.
That's starting in 2021.
Yeah, meet the new normal. There's your new normal. Stand in line for a dialysis machine. So as much as everybody talks about vaccines, they're killing everybody in the hospitals too. They killed over 1 million Americans by all these different methods. Now, these are different age groups. You don't have to look at the numbers. I'll read them to you, but just look at the shapes. Top left, that's 25 to 44-year-olds. That's 63 people in 21 and 22. And you can add another 20 to 30 for 23. It's not even on here. And you see how high it is. And then the next one over to the right, 45 to 54, and then 55 to 64. That's 269 people in 55 to 64, 65 to 74. This is every age group. I'm showing you this because it's important to note this is not just old people. They're murdering young people down to 25 years old. I didn't even put the 16-year-olds here, but they're murdering them too, 16 to 24.
John,
and you can see.
Real quick, John, have you ever done analysis on the COVID deaths and that have acute renal failure along with the COVID diagnosis? Have you done any analysis on that? Because that would be really interesting to see, because with all the theory now, with we're learning that they put everyone on remdesivir and killed their kidneys. Have you done any analysis on that, on COVID deaths with acute renal failure?
Yeah, I'm embarrassed to say that I know I did it. I can't remember. I've been doing this for almost 2 years now. That's a big one that needs to be done. And I do plan on doing it for the new state. When I do it for the new state, I have somebody who wrote some code for me. And the tool is now, whenever I run a code, my system takes 20 minutes. I walk away from my computer for 20 minutes. And then all the graphs generate automatically. I just type in J189, I walk away. 20 minutes later, all the graphs are done. With the new system, it's 2 seconds, and then it's cut and paste of less than 15 seconds. So I can do the whole process in less than 15 seconds. So the 20 minutes was taken down to 15 seconds. So I will be doing that. But it's been so difficult whenever I find something new, like what do I choose to do? Because whatever I do is going to take 20 minutes, even just for an age group. So now I can do anything now.
To take David's question a little further, there may be additional renal failure deaths that don't show up because they're listed as COVID deaths, just a general COVID death, died of COVID, and they don't even list that the fact that it was a renal failure that caused the death. Is that possible?
Sure. Yeah. The death certifiers, I believe, if there's a problem they know about, I believe the bias will seep into their daily work and they will try to hide it. I know that they do that because I interviewed somebody for 3.5 hours and reviewed hundreds of death certificates, and that person worked or works, he or she, in Boston.
So as high as these renal failure numbers are, they could actually be much, much higher.
Could be, yeah. Yeah, I don't think that they lie by adding it. I think that they might lie by subtracting it, like they lie by adding COVID. But then now we're into an area of, trying to game the system of manipulation, which I'm fine to talk about. Like cardiac arrest deaths went really high, but I think that they caught on and they stopped coding cardiac arrest. But just see this graph. I mean, I have the guardrails, these gray lines. There's so much excess that I was able to stick the age under here. These black lines are supposed to be right through the ages right here. That's a lot of dead people.
Yeah, I mean, those are also called trend lines, right? Besides, in addition to calling them guardrails. And could you mind going back one, the one that you were looking at before? Like, let's take a look, if I may point it out to everybody, 65 to 74 on the top, right? Go all the way to the left. And it's bouncing around quite a bit, but it's always within those trend lines. And until you get to the end of 2020, it stays, and then suddenly it just blows right out of those trend lines. A trend that it's been on consistently since at least 2015, probably earlier if you had a chance to look at the data.
Yep. In fact, that first wave of COVID was right here. Don't forget, and it's in the mix. This is just about November 15th. Boom. It's 2 weeks after. It's 2 weeks after the. And is this using? Oh, this is 51-day rolling average. So being a 51-day rolling average, the start point could be off by 26 days. So it could be 26 days earlier than it really happened. This is the November 2 date right here. That's November 2 right there. Boom. That's what happened.
And just could you remind our listeners what happened on November 2020? What was the big significant thing that happened?
That was the NCTAP funding from the federal government. Anytime that they put somebody on remdesivir or baricitinib, and there's others, but those are the two key ones, the entire hospital bill gets jacked by 20%. So if somebody was in the ICU for $1 million, the hospital gets an extra $200,000 if they used remdesivir. And so as soon as a patient tests positive, and I have it in the CDC memorandum where somebody was 95% oxygen, all vitals normal, 105 over 70 something blood pressure, heart rate was under 60, breathing was 15 breaths per minute. Oxygen saturation was 95%. They put her on remdesivir on a positive COVID test. That's it. And then they proceeded to kill her at 28 years old.
Wow. So again, guys, if you just focus on one of the charts, the top one, 65 to 74, and you can see 2020, and then John tells us they changed the payout schedule late 2020 in November. And that's where it breaks at least a 6-year trend.
Yeah.
And then it explodes.
There were EUAs for remdesivir in April by age groups. There was older people in April, then May. Then there was one on October 22nd, and that didn't really do much. But the November 2nd, and I know it's like 11 days apart, right? But the November 2nd one, 2 weeks after that, it explodes. Acute renal failure just starts rocketing.
And most of our listeners know, but remdesivir contributes to acute renal failure.
That's what they say. I think it's go ahead. Sorry, David.
The reason why I was asking John about the COVID deaths with acute renal failure was because of that. Because in my research, when I've done a lot of research on the alleged COVID deaths here in Minnesota, and strangely enough, a lot of times a contributing factor with the COVID, allegedly, is acute renal failure. So I just thought, wow, what a coincidence. I mean, is it just a coincidence that a lot of these COVID deaths also happen to have acute renal failure? Is it also a coincidence that they probably were on remdesivir at the time as part of the hospital protocol? So that's why I was just curious if we could do all the COVID deaths and then remove the acute renal failure deaths that were associated with the COVID deaths. And a different analysis sometimes. But that's why I was asking about that. But yeah, this is all really fascinating. And I also just want to point out really quick for everyone, once we're done with John's presentation, I actually happen to have the 2020 official Minnesota death stats up on the screen here. And I'd love to show everyone just how intense this database of records is. It's a huge, it's the largest spreadsheet you've probably ever seen in your life, folks. And so I just want to share that with everyone, so you can see all the data that John's been analyzing here. And I want to encourage everyone to maybe analyze it yourself. You don't have to just trust our analysis, our interpretation. What's great about Minnesota is one great thing about the Minnesota Department of Health is they don't actually make you jump through any hoops to get the data. Other states, like for example South Dakota, we were trying to investigate that case of the young girl, 7 years old, that went to South Dakota with an alleged COVID case and then died. We were trying to look that up to see if she was put on remdesivir event and stuff like that. Well, South Dakota, their health department, they make you prove that you're some kind of official researcher. They want to see what the research is going to be. They make you jump through all these hoops, and we were not approved. They didn't approve our application. But unlike South Dakota, unlike many other states, Minnesota, all you have to do is send an email to Minnesota Department of Health, and we're going to give you the email address here at the end of our meeting. And all you have to do is ask nicely for the death records for any particular year. It's a $15 service fee that you pay them, and then they send you the spreadsheet of all the deaths. So it's super easy. It costs $15, no questions asked. It's kind of scary, all the data that's included in this file, because when someone dies, it includes their some of their family members and their full addresses and stuff like that. So it's crazy that you can just get this information from the state of Minnesota just for paying $15, but it's highly enlightening when especially if you're trying to look someone up. You see someone, oh, they died of COVID on the news, and you look them up, and oh, what do you know? Acute renal failure, and then oh, what do you know? They were put on a vent or whatever. So I'm really going to encourage everyone to look into the stuff themselves. Don't just take our word for it. Don't just take these graphs at face value. Look at this data yourselves. It's available to you. So we'll go back to John.
Thanks, David. All right, I'm going to try to go through this. This is the end of acute renal failure. Remember I said there were 63 people 25 to 44. These are parents of young kids, or they're kids of people in their 60s and 70s. There's a lot of people. Just look at the two bars on this thing, or the one bar with the fiscal years. This is insane. Now let's look at Massachusetts versus Minnesota with regard to subcutaneous tissue and skin disorders. Who would think to look at that? One of my relatives died. He had a cancer that was going to take 15 years to kill him. He'd die at like 95. If it was slow growing tumor on his kidney. Well, he got his 2 shots, then he got his booster, then it metastasized, went to his lymph nodes. He also got a bonus of pericarditis, and he had to go through treatments. It was terrible. The last 3 months were just terrible. And he had these, he told me he had these holes in his legs that wouldn't heal. He had these lesions on his legs that wouldn't heal. So I came home and I'm like, I got to look that up. I never did L codes. So I looked at the L codes, L98.8. These graphs look the same, but one is Minnesota and one is Massachusetts, and they're 1,300 miles apart. What are the odds that the medical examiner staff would get a message, hey, why don't you start writing these lesions down, and they would be coded the same way by the CDC's automatic software? No, these really happened. These really happened. People have holes in them that won't heal. It's disgusting.
It looks like this one took a little more time to kick in, but once it did, it was really virulent, which kind of makes sense. It takes a while for a skin disorder to appear.
Your immune system is it's either your immune system attacks itself. So a bullous pemphigoid is your skin is getting attacked subdermally by your immune system. And then you're having these blisters and redness, these blotchy red. The pictures are all disgusting. Some people have actual holes in them that just are sitting there. They won't heal. And then there's hospital protocol murders. I'm almost done. 4 acute kidney deaths in the CDC memorandum. I'm not going to get into them individually. I apologize to anybody from Minnesota who wanted to hear them. It's too much. It's already been a couple hours. The one 69-year-old man went into St. Mary's. He was hit with remdesivir immediately. He died of acute renal failure. Another 67/69. Why? Because the VAERS report said the hospital report says 67. The death certificate says 69. But it's the same guy. I know it is because the name's all over some of these are 2,000 to 4,000 pages of hospital report that I have. The family shared with me. It was a 40-year-old man had remdesivir. The 67-year-old man had baricitinib. 70-year-old man had neither. And then I have a couple others from other states. Of all 5, I have 2 remdesivir, 2 baricitinib, and 1 had neither. But all 5 had vancomycin, and all 5 died of acute renal failure. And then Detroit, Minnesota, until the real CDC does Minnesota. So, well, what does that mean, actually? I forget. I wrote it. Somebody out there who speaks Norwegian can read that and tell us in the chat what that means. For oh, that's all for now. I think that's all for now, Minnesota. That's all for now.
You had a
Yep.
great Minnesotan accent. That was great, John. We do actually have a bunch of questions in the chat box right now for you, John. And like I said, I will come back to that spreadsheet. And also, we wanted to talk about as a bonus, we're going to look into the investigation of the death of George Floyd. But just as a bonus and a small thing, we're going to look into that. There's a couple weird things about that. But anyway, so Anne's wondering, can you share more information on, I can't even say it, barachnicide, not remdesivir, the other one.
Baricitinib. Yeah, baricitinib.
Yeah.
I can't remember what it is. I'm not a drug guy. I have a tough enough time figuring out what all this medical stuff is. I'm an engineer. When I look,
listen, gentlemen, wow! I just saw this one from Laura. My husband was killed on December 14, 2021 by the protocol. He got baricitinib, and the last thing on his death certificate said, unvaccinated for COVID-19 as a contributing cause of death. Wow. I hope his death certificate is in your book.
There's now an ICD-10 code for that. There's an unvaccinated cause of death. There's an ICD-10 code for that. There's also one for vaccine as a cause of death, U12.9. And New Hampshire, the Department of Public Health in New Hampshire, or the Department of Health and Human Services, they sent two bureau chiefs to go against the bill that I wrote. So I spoke for my bill. It's on camera. You can find it out there. But the two bureau chiefs from the department spoke. And one of them was like, well, they were asked a question by a House rep, are you concerned? It's like, well, we look at the data. And it didn't say much. And then the next question was, well, what about these young people dying of these things? What have you found? What have you looked for? And he deferred to the woman, and the woman said, well, before I came to this meeting, I had one of my staffers look up U12.9 to see if there were any vaccine-caused deaths. And there were none in New Hampshire. It's like, really? Because I don't think the CDC adopted U12.9. That was from the WHO. We don't adopt all the codes they do. And if you read the notes in the UK and Germany, under U12.9, it says it's a subcategory of Y59. We do use Y59. The CDC does code for Y59. Did New Hampshire look for Y59? No, because this stupid woman whose job it is, and his only job it is to know all the data, she had her staff look for U12.9. Hey, lady, do your job. I think she's doing her job the way they want her to do it, which is hide all the vaccine deaths. And she did a good job getting up there and hiding all the vaccine deaths and lying, outright lying to the House members who were asking her the questions. Sorry.
Baricitinib is an immunomodulator, and so basically what it does is it changes the way your body's immune system works.
It suppresses your immune system so you don't have a cytokine storm. That's what it is. Yeah.
And it got an EAU. EUA.
Yep.
And then you say, sorry to interrupt, but you say it was also financially incentivized.
Yeah, same as remdesivir. Yeah.
Amazing. Okay.
And if you give too much, somebody says it kills the kidneys. But if you go to look for papers on that, you'll have a hard time finding. There might be one paper on that, but it is listed in some of the literature.
So Anne pointed out that June 8th through 9th is the Sheraton Denver Downtown COVID Litigation Conference with Warner Mendenhall. I think that's maybe what you gentlemen were referring to earlier. Mandy's wondering, did you see any death data correlating thrombolypemia? I'm not very good at these conditions.
Thrombocytopenia?
No, thrombolypemia with COVID.
What?
I'm not very good. Did
she have a loved one die of that?
I know Mandy. I don't know. Mandy, if you want to just let us know on that particular detailed. Did you have a loved one? And I'm going to go
Thromboembolism?
ahead.
That particular.
I'll show you what I'm talking about. Okay. So yeah, blood clot in the vessel.
Oh, phlebitis. Yeah. Thrombophlebitis. Yeah. In fact, in Massachusetts, um, intracranial, intraspinal phlebitis and thrombophlebitis is G08, I believe. And so you can actually categorize a CVST, which is a cerebral venous sinus thrombosis type of hemorrhagic stroke, can be categorized under the G, I think it's 08 or 04. I think it's G08, phlebitis and thrombophlebitis. That's thrombocytes, platelets, clotting, causing phlebitis, swelling, and it could be your spine or your brain. It could be other places too. But when it comes to the brain, yes, the signal's sky high in Massachusetts. But I didn't find it in Minnesota. That doesn't mean it's not there. Just means that they probably wrote different words, and they might have just left it at acute intracranial hemorrhage or stroke or some word like that. It might be, you might have had an I6 something. I don't know. I would have to see the death certificate.
Okay, and also I want to share with you guys a great resource. So when you start doing some of these investigations yourselves, like I'm encouraging everyone to do, a great resource that John actually turned me on to is this website right here. It is the best for looking up ICD codes. Unless you happen to be really smart like John, you're not going to be able to remember them. So what you do is you bookmark this website, which is icd.who.int. I'll put it in the chat box. And what it allows you to do, guys, is you can actually just search up here for the ICD code, and it'll show down here. So for example, remember how people said, oh, no, there is no such thing as an ICD code for vaccine death. No, John was right. Bam, right here. Y59.9 is vaccine or biological substance unspecified. Death by. So, but this is a great resource here. I'm going to put this in the chat box. It's icd.who.int, and it literally is the easiest one because what it allows you to do is when you see the ICD code, which we're going to look some up here in just a second. For example, George Floyd. We'll look at one of his. His was X42. That was the main one that he died from. If we start just typing X42 up here. Yep, here it goes. It actually will pop. It will kind of like it'll pop up right here, and so then you can click on it. What was that, John?
Hallucinogens and psychodysliptics. Go ahead, bring it up.
Yeah. So I just wanted to point that out. This is a great website if you're curious to look up ICD codes. Of course, the COVID ICD code is U071. That's for an alleged COVID death, the U071. But that's why I was saying earlier, if you want to take this upon yourself, folks, try to find, here's a challenge for everyone. Try to find in the Minnesota death stats anyone that died of only COVID. You're going to have to look really, really hard. And like I said earlier, the ones that I found, a lot of the ones that I found that, when I was looking at the COVID deaths, a lot of them did correlate with renal failure. So you have to wonder about that a little bit. But let's take a look and show you folks here what the death stats actually look like here in Minnesota. So this is a spreadsheet. Now, if you're not in the spreadsheets, it's going to look really crazy, but it's a spreadsheet, and it goes. I'm going to just scroll from left to right. So I'm scrolling from left to right. You can see it's like the longest spreadsheet from left to right you've ever seen, and it's also a really long up and down. So I'm going to scroll here. Let me go all the way back to the beginning, and we'll scroll all the way down, and you'll see. I mean, it's a lot of records. And I'm not a spreadsheet guy. I know some basics, how to copy and paste some stuff. Well, if you look down here, it's for this one year of 2020, it looks like 52,000 records. 52,000 records times all the different data points within each record. So keep that in mind.
So this is what John has done for us. I mean, he's gone through this. He's asked specific questions. And you mentioned the word interpret way back. I mean, John, to my mind, you're not interpreting anything. You're just showing graphically what the heck the numbers say. You're not
Yeah,
saying, oh, I think it's this, I think it's that. It's like, well, I went through the spreadsheet, I ran the programs, I asked this question, and here's what it looks like on a chart.
yep. I show raw data. I don't get into statistical methods. I don't want, if you want to bring a PhD on, I was just going back and forth with one on Thursday. Epidemiological statistical methods, I believe, are inappropriate. A normal distribution, a binomial distribution, a Poisson distribution, and none of them are going to work, because as soon as you change a bunch of variables with political policy, you change what's normal, and so your mean and standard deviations are going to be different from the prior 5 years as soon as you make a policy to make people's behavior different. Okay, they're not going to spread diseases the same if they're not going to work, or if they're not touching the same handles, or if the airflow is different. Masks do nothing. That's not going to change anything. That's not a variable. I should tell your crowd about masks in a second. But yeah, I just give raw data. You're absolutely right, Ken. The simple thing is, people have said, "Oh, he's lying." I'm like, lying about what? It's not my data.
Exactly.
It's Massachusetts data. I didn't do
And
it.
it's not your theory about anything or your interpretation of anything. You asked about specific age groups, specific disease states, et cetera, et cetera. You went to
Yep.
this data, and then you figured out how to print it all out so people could see it graphically. So can you tell us again about your books and how people can get them?
Yeah. So the real CDC is out. It ships from the printer on Monday to the fulfillment house. So another week, I guess. The CDC memorandum is another 2 weeks behind. The real CDC is for everybody to read. It starts out on St. Patrick's Day in 2020. And then it gets into data, and I explain a lot of stuff. Oh, is that what my site looks like now? Your friend helped me out with that. Thank you. The CDC memorandum is kind of heavy. It's just really heavy on data. It's a memorandum as a legal notice to officials, but it also has a legal analysis in there. It has 155 pages of 400 graphs of various causes in Minnesota, Massachusetts. You can find them at therealcdc.com. Real easy. I was happy to get that website, therealcdc.com. It's on pre-order, and yeah, so that's that.
And people can order right now, even though the book won't be available for about a week. But there's nothing that prevents them from putting their order in.
Yep. Real quick on the masks, you might, since it's Mask Off Minnesota, I sued the governor of Massachusetts over the mask mandate in federal court in June of 2020, early June. Like I wrote it in May. The mask mandate was initiated on May 5th. I'm not a lawyer. I didn't know what I was doing. I played in an over 50 soccer league. One of the guys is a Harvard lawyer. I said, flip me one of your successful lawsuits. So they sent me one. And I was like, I'll just copy that. But I'm deaf in one ear completely from getting a shot when I was 4 years old. And I went completely deaf. They mixed streptomycin and penicillin together because they didn't have a vaccine. But they wanted to inject kids with something. So even though I didn't have the Hong Kong flu of 1968, they just injected me along with a bunch of other kids, and they made a bunch of kids go deaf. And that is how they learned that mixing streptomycin and penicillin causes people to go deaf, especially small kids. So I said, you're depriving me of receiving free speech from others, receiving, not speaking, but receiving free speech, because you're covering their mouths so I can't see their lips. And it helps me hear when I can see people's lips move. So that's a First Amendment violation. They must have freaked out because he rescinded the order. Order 31. You can look this up, Massachusetts Order 31. That was put out on, I think, May 1st. It was to take effect on May 5th or 6th. In November, I filed my lawsuit, and then they had to do a motion to dismiss, and then I forget what happened, but all of a sudden in November, he rescinded the order 31 and reissued order 55 with an exception in paragraph 2B. The exception is, by and between anybody hearing impaired doesn't have to wear a mask, meaning not only didn't I have to wear a mask, no one speaking to me had to wear a mask. specifically to get around my lawsuit. He screwed me out of court because you have to have standing. I had no issue. I had no issue personal to me because I didn't have to wear a mask. No one speaking to me had to wear a mask. I'm out. Case dismissed. But I never had to wear a mask. Well, that's why I got in, people yelling at me and swearing at me. They put me to the turf 3 times on a full sprint playing over 50 soccer league, and my knees were bleeding. The scabs lasted 8 weeks, 10 square inches per scab, just blood. Anyway, what then? Then I did a public records request, state FOIA. All the emails by and between or among the governor, the public health commissioner, and any of the minions that mention the word mask or face covering. I got nothing for months. And then I think in 2021, like late in 2021, I got 1,200 pages. And among those emails, you're going to love this. Among those emails, the Public Health Department of Massachusetts contracted with Professor Gregory Rutledge at MIT to test the samples from the 1-point-something million masks that the governor had flown in from China on the New England Patriots jet. The New England Patriots loaned their jet to the state, which went to China to pick up. This was a coup. Nobody was getting masks. Nobody had masks. But the governor of Massachusetts got the Patriots jet to go to China, pick up 1 million masks. I got this in the internal emails. They had Professor Gregory Rutledge test them in March and April. And on April 20th, 2020, now remember I told you the mask mandate went out on May 1st to be effective on May 6th. On April 20th, 2020, 2 weeks earlier, Professor Gregory Rutledge told them the result of all the tests of the masks. They don't work. They didn't work. The KN95s that they got from China didn't meet the 95% spec, and none of the others did either. And this is across a test fixture with no leaks. Some of them were 38%, some were up to 82%. None of them were near 95%. I mean, 38% is freaking useless. Why even have it? It can't stop the particles. And then there's also lots of literature among that 1,200 emails. They all went to fit testing and training on how to don and doff a mask. They had to have training, fit testing every single time you wear it. You're supposed to be spritzed with some stinky stuff, and if you can smell it, you got a leak. But they passed an order. They get down to 2-year-olds wearing masks. They knew they didn't work. They know they don't work. That was 2 weeks before he ever issued an order. And I have the proof that they know. I have the internal emails. So thanks for listening to my story, because I know you're a mask. You started out as a mask off group. So good story, huh?
Yeah, no, we're getting lots of thumbs up and comments and hearts and emojis in the chat box there. So yeah, people are loving that. I just want to applaud you right there. That is fantastic. I mean, that's what we're all about, by the way, is how we started was we didn't want to just be a bunch of people that complained about being locked up and having our rights taken away and all that stuff. We wanted to take action. So we call ourselves, and it sounds kind of funny, rats, real action takers. I know. But that's what we are, because we're all about taking action. So we love that, and I love hearing that about that. Love hearing that about you, John, and about that. John, can you tell everyone the crossing the road analogy? When you and I chatted a few weeks ago, you gave me this really good analogy about the person that helps the kids cross the road. What do you call that person? The
crossing guard.
Crossing guard, yeah. Can you tell that analogy for all of our listeners?
Sure. I tell it differently each time, so I make it up as I go, right? So you have to understand that certain people have a legal duty to act. Okay, what that means is if there's a 7-year-old boy drowning, and he says, "Throw me a life preserver. It's right there next to you," and I look at it, and there's the life preserver, and I just have to toss it like 3 feet. And I'm not his relative, and I've never been a lifeguard, and I'm not a cop, and I'm not a fireman. I could say, "Good luck sinking to the bottom, kid. Can I watch?" I can let him die. I have no legal duty to act. That's true in most states, right? In most states, you don't have to save him. But if you've had, 10 minutes of lifeguard training when you were 16, you have a legal duty to act. If you're a cop, if you're a blood relative, not a cousin, but a close blood relative, you have a legal duty to save him. Now, certain functions like the cop and firemen and so forth have legal duties. The public health department people, if they're presented with information that a lot of people are going to die, if a certain medication is given or a procedure that they recommend is killing people, if they're given notice and knowledge that they're killing people, they have a legal duty to stop that, to investigate and to stop it. Now, if Johnny comes up, he's going to cross the street, he's looking around, the crossing guard's right there and says, "No, Johnny, you don't cross the street until I tell you. You look at me, you don't look at the street. I'll tell you when." And here comes a bus, and the bus ain't stopping, and it's going like 50 miles an hour. And the crossing guard's like, waiting for the bus. Here comes the bus. "Okay, Johnny, go." That's murder. That's what the CDC and FDA have been doing. They have knowledge. Okay, they've been given notice. They have knowledge of all these deaths. They're lying when they say they don't know. But the CDC memorandum imparts notice on them. It's going to be served to them. It's going to be validated that they received it, whether it's certified mail or whatever. They can't say they didn't know. There's more information in the CDC memorandum in one place than any other body of evidence I've ever seen regarding COVID. There's nothing like it in the world. And once they have notice, they have a legal duty to act, to investigate. And if they don't act and somebody subsequently dies in a reasonable time, these are legal terms, in a reasonable time after they had that legal duty to act, to investigate and then take action. If somebody dies, I do an analysis of, I do uttering, involuntary manslaughter, felony murder, where the felony is the fraud, and it's an inherently dangerous felony because the fraud involves the medical battery of an injection. And lastly, depraved heart murder. So yeah, Johnny is looking at the crossing guard and she tells him to go. That's murder. She has a legal duty to protect him. Not only is she not protecting him, she's trying to kill him. She knows the bus is coming. Is that the story that I told?
Yeah, and she tells Johnny to not look both ways himself. Only trust her. she's the expert.
That's
that
the
was
key.
the other part. Yeah,
that's the key.
That was the other part. And I thought that was
guys, David, you live in a time zone where it's only 9:30.
That's
I don't live in a time zone like that, so I'm going to check out. But I just want to remind everybody, therealcdc.com. That's where you can find out more information about what John's been talking about. That's where you can pre-order the book. Just go ahead and order it. It's going to be shipped in a week or so. So just take care of it now. And all the things that he's been talking about, you're going to find in detail in the book. You'll be able to, buy extra copies, give copies to your library, give copies to friends that are interested. I mean, really spread this book around, because this is some breakthrough data and not interpretation, but representation of just the plain numbers that have been kept away from us for so long. And John's the one person who's done this basic. I mean, it's not. When I say basic, I don't mean easy, hard to do, but this basic research, this basic representation of fact. And then the second book, which is what's the name of it again? It's the
CDC memorandum, and I forgot.
Yeah, the CDC memorandum is the legal document that John's drafted that he's going to present to all these people that really puts them on the hook. So that's going to be fun reading too. So it's all at therealcdc.com. And good night, everybody. I got to go.
Good night, Ken.
Thank you so much, Ken.
The ebook is this week. I forgot. Both the ebooks will come out this week, I think.
Hey, all right. Okay,
yeah,
take care, guys.
That's awesome. Great news.
Thank you.
Thank you so much, Ken, for joining us. So, John, you have just you have a little bit more time, right? We have a few more questions. Sure. I wanted to kind of just also bring one into the spreadsheet a bit more as well. and kind of just bring everyone up to speed on that. But let me, yeah, this is really good. Let me make sure. Oh, I wanted to bring up. That's too bad Ken had to leave for this part. So, John, I'm not as smart as you, and so I actually started using ChatGPT to analyze the death stats. And what's really, I just have to share this with you and everyone else. So I was having to do acute renal failure on the death stats from Minnesota Department of Health, and it was doing it great. It was giving me graphs and all this sort of stuff. And then I started asking for COVID-related investigation death stats. All of a sudden, it aired out, and it all of a sudden could not help me anymore. And it said it could not read the data anymore, mysteriously. So I found that a little bit strange or interesting. But anyhow, let's go ahead and bring you guys back onto the spreadsheet. And I just want to show everyone just some basic stuff if we can. And John, I want to hear your feedback on my very basic methodology here of investigating the death stats here. So once you get the spreadsheet, let me bring the screen back up here. All right. Like I said, it's a very long, list of data. What we're going to do now, how you sort it to find people is really up to you. But how I like to, if I have the last name of the person that I want to look up, I go to the last name column here, and I sort that, by ascending or descending, depending on, if their last name is earlier in the alphabet or later in the alphabet. Now, it's such a big file that it does sometimes take a few seconds for that sort to happen. But there it goes. So now it's sorting all of the deaths. Now, this happens to be for 2020 in the state of Minnesota by last name. All right. So what I can do, for example, if I wanted to find Floyd, all right, George Floyd. As an example, you can find anyone, obviously, but we go down to, scroll down to where we find Floyd as an example. And now it is a lot more complicated if it's a common name. I've noticed, so it will take a little bit more time to research, but eventually you'll find, here we go, George Barry Floyd. And if you scroll way over here, you will find eventually, like I said, you have to scroll a long ways. You'll find the causes of death. Now, these are written in the English language. They're not ICD codes yet. Further on the spreadsheet, there's the actual ICD code. So, John, just to clarify, because Ken was asking you about this. So, when Minnesota, provides this data to the CDC, it must be the CDC then that's adding the ICD codes way over here, which I will get to. See, they're so far over. Here they are. So is that how you understand it, John? That the Minnesota Department of Health provides the data, CDC reads those English words, and then populates these codes right here.
Yes, Transax and Acme software are run by the CDC. The codes are generated, and their death records are returned with the codes to the states.
Okay, so what's interesting about this particular case here, if we go back over here, let's read what's written in English here, okay? So this one, it says cardiopulmonary arrest complicating law enforcement subdual, restraint, and neck compression. All right, so the part that's interesting about this is the neck compression part, because when we actually look at the ICD codes, let's go ahead and let me just bring you to the ICD codes here. So I'm going to change my screen to where that is. I have a lot of screens going on, so it's a little bit complicated moving all my screens around. Share something else. Here we go. Okay, so here are the ICD codes in English, so to speak. So the number one code that's given in the spreadsheet here, the first code that's listed is X42, which is, it says accidental poisoning by and exposure to narcotics and psychedelics or whatever that is, hallucinogens, not elsewhere classified. Now, I want to ask you, John, normally, in the spreadsheet, how I understand it, the first ICD code that's listed is considered the, what do they call that at the very top again?
It's not the UCOD. It's, okay, when you look at the spreadsheet from Minnesota, if it might be the first code listed in the spreadsheet for Minnesota, but it'll have a different designation because there'll be a category 1 through 20, and then before that would be, yes, the UCOD. That's correct. if you look at the death certificate, the UCOD is the last, it's supposed to be the last one written in part 1 of the death certificate. So you have A, B, C, D. If there isn't anything in D and there is something in C, C is the last one. If there's nothing in C, B is the last one. It's a reverse time order. So that's the UCOD. It's supposed to be. But CDC's been messing with the UCODs. They've been moving them around. So the ones they're coding aren't necessarily the right one from the death certificate because the death certificates are improperly filled out. It's a mess. The whole system's a mess. But go ahead. Sorry.
Well, what's strange about this case, and I was watching a video where you were actually on a different show talking about this a little bit, is, the whole neck compression thing and whether or not the medical examiner was, encouraged, coerced, whatever, to add that. Because if you look at these ICD codes, nothing on here talks about anything to do with the neck. And the number one ICD code there is the poisoning by the drugs. Second one is unspecified mental and behavioral disorder. But if we actually take a look at the report that came out, this is actually on the Hennepin County's website still. It's right here.
Yeah, you could argue that Y356 would include that subdual neck restraint. I mean, I don't like it, but you could argue that.
You could argue that, but what's strange about it, though, is there is evidence of this medical examiner saying things that kind of go against that a little bit. So, for example, I've got it right here. That medical examiner, he was being quoted in something else, and he said he told me, well, it's a different case, but this is attorney that's talking about her dealings with this medical examiner, and she's quoted this in a under oath. He told me that there was no medical findings that showed any injury to the vital structures of Mr. Floyd's neck. There was no medical indications of asphyxia or strangulation. He said to me, Amy, what happens when the actual evidence doesn't match up with the public narrative that everyone's already decided on? And then he said, this is the kind of case that ends careers. So that's what she said, the medical examiner said. Now, he later claimed that he was not pressured at all on that autopsy report. That's what he claimed, because one of the attorneys for the police asked whether he was pressured in listing neck compression as a factor in the autopsy report. Baker testified that he told prosecutors on the day of Floyd's autopsy that there was no physical evidence of asphyxia or insufficient oxygen. So just find that really interesting. We could dive a lot deeper in the whole George Floyd case. Obviously, there's a lot more to it, but it's really interesting that in the actual medical records, it's listed as homicide. But if you look at the specific reasons, it's hard to find. When you look at all the ICD codes, like accidental poisoning, unspecified mental disorder, hypertensive heart disease. I mean, but end of the day, it's labeled as a homicide. So it's very interesting. Once you get into the death records, you can see these ICD codes.
Yeah, David, do you want me to explain now what I found and why I was raising? Okay, so
yeah, please.
The last thing that's supposed to be in the part 1 of death certificate should be the UCOD, the underlying cause of death, which is a terrible name for the root cause of death, the beginning thing that started the causal chain that caused the death. So the first thing that happened should be the last thing listed in part 1. Well, it's not acute fentanyl intoxication. It's not fentanyl overdose. That is mentioned, I think, maybe in part 2. But the UCOD listed, like you said, the code that's listed as the UCOD is still X42. Now, here's what would happen. Here's how this could have happened. Somebody writes out a death certificate. They send it to the CDC. The last thing in part 1, intending for the fentanyl overdose to be the root cause of death, the thing that started the causal chain that caused death. It gets coded for UCOD. It gets sent back to the state. Somebody in Minnesota, very, very highly likely, changed the words on the death certificate, but didn't understand the coding process, and why would they? They forgot to change the UCOD of X42 being the UCOD of George Floyd's death certificate. Still to this day, it says the X42 fentanyl overdose is the underlying cause of death. So how can that be? It's in part 2. Somebody must have changed the death certificate after the original death certificate. Does that make sense? That's what I'm saying.
Yeah. So let's show everyone one more time here so they can see it for themselves. Because yeah, I didn't really believe this at first, but then I looked it up and I
Somebody
confirmed
raised somebody brought this to my attention, and I kept blowing her off, and I feel terrible because I was just always so busy. I'm like, yeah. I didn't want anything to do with George Floyd. But then I looked at it and I'm like, holy crap, she's right. No wonder why she wanted me to look at this. And the more I looked, she kept saying, it's the UCOD, it's the UCOD. And I'm like, yeah, the code is the UCOD, but the words don't match. And I know that they go to the CDC. So then it clicked. They changed it. They changed the words on the death certificate. Then, the funny thing was, I was talking to a doctor. I don't want to say who it is. I'll give it away if I say it. Neither of us knew that the other didn't know that somebody was an expert witness. And so we're talking, and he assumed that I knew he was the expert witness. And I'm trying to tell him, somebody changed that death certificate. It was an awkward conversation. And then when we realized, I had no idea he had any involvement in the case. I was just talking to him because he lives in the area. And it turns out, we shouldn't talk. We shouldn't talk about this. So we didn't talk about it.
Well, according to the Minnesota, according to Minnesota death stats here, the primary cause that's listed here is the cardiopulmonary arrest complicating law enforcement subdual.
That's different. So there's primary. So you got to go through A, B, C, D. What's in A? Cardiopulmonary arrest complicating law enforcement subdual restraint neck. You got to expand that. If you double click on it, it'll. You don't have to expand that. If you double clicked on it, what does it say in B? Is there any B?
This one is so the secondary to B is arteriosclerotic and hypertensive heart disease, fentanyl intoxication, and recent methamphetamine use.
Wait a minute. That's not what it said before. That's B? No, that's not B. That's part 2.
That's part 2.
What's the type? You got to freeze your headers so you can read these things. You got to freeze your header column.
So I don't know anything about spreadsheets. So yeah, how do I freeze my headers?
Yeah. You got to go all the way to the top where the headers for each thing, and then you click on that one part of the left, the number row 1, within the one from row 1. So how do you freeze headers in Excel? I use numbers by Macintosh. There should be a freeze. Is there a hyper thing up there? Click rows and columns up there. See what happens.
Rows and columns. I don't see it at the. Oh, right up here. I see. Yeah, rows and columns.
It should say freeze. How do you freeze?
Freeze panes. Here we go. Freeze.
Freeze panes. That's it. Freeze panes.
So what does that do? I freeze to row?
You'll see. Freeze row 1. Freeze row 1. Go ahead. Click
okay.
It. And now scroll down.
Hey, there we go. That's $1 million tip right there. That's worth staying to the end, folks. So you just saw $1 million tip.
All right, go down to George Floyd.
Wow, that's so much better.
So it's other contributing factors. I was right. You were looking at other contributing factors, which is part 2 of the death certificate, not part 1. So you see now you can see the A, B, C, D, right? Line A, line So what that means is the root cause of death should have been coded as that whatever's at the end of that subdual neck restraint thing. What was at the end? I'd have to read that again. But instead of saying that, it has X42. It has the root cause of death as the contributing factors. How the hell did that happen? Doesn't happen. So somebody moved things around on this death certificate after it was coded. I have a hard time believing that software is that bad. See how it says, other contributing factors under column 140.
Yeah.
That's part 2.
Okay.
That's not causes of death. Those are just contributing factors. Part
Gotcha.
1, the last thing is neck compression, okay, and then restraint, subdual, enforcement, complicating law. I mean, the cardiopulmonary arrest is just an I-4-6, right? It's an I-4-6-9 or I-4-6-1. That's just your heart stopped. That it literally means your heart and breathing stopped, cardiopulmonary arrest. Yeah, there's something from that phrase should have been the UCOD, likely the neck compression. They should have said that this should be some type of, I don't know the codes for the physical stuff. You know, there was one in Minnesota that said it's a W code. Aaron Hertzberg found this, or I think he found it, or the other person I'm not supposed to mention found it. It said she died like 2 days after she got the shot. You know what it was coded as? Think English words. She died 2 days after she got the shot. What would it be coded as? She died from a gunshot wound.
Wow.
Because it said 2 days after she got the shot. So
the
whoever
shot.
filled out the death certificate used the word shot instead of vaccine. And because they used the word shot, the software automatically coded it as a gunshot victim.
Wow.
So,
Wow.
hey, the automatic software works. It's reading the English word and applying the right code. She died of a shot. She got shot. So when they say, you know, oh, the CDC missed all these vaccines and vaccinations, bullshit, the software missed it. They deleted them. They killed Americans on purpose. They fooled everybody into believing that the thing was safe and effective because they deleted the Y59 codes that were generated by Transax and Acme. Your government wants you dead.
And they're covering it up. Clearly, they're covering it up. And, you know, it's interesting about the death stats. The reason why we got into the death stats here in Minnesota was the very early days, you know, on the news reporting, oh, there's 10,000 new cases and, 5,000 new hospitalizations. And those stats you can never independently verify. It was just what the news reported, you know, from the Minnesota Department of Health or wherever. The death stats, though, finally we could actually, you know, even though they can still miscode things here and lie here, but at least now.
What do you mean, finally? I did this 2 years ago, David. I did this 2 years ago. You go to my Substack right now, and you can read stuff from 2 years ago. And I proposed how to solve it a year and a half ago by correlating the death certificates. I finally got other people. Kirsch was saying it like 6 months later. He adopted it. The bill I wrote. Now other people are doing bills. There are bills all over the United States trying to do what I did. Maybe they'll get them passed because I couldn't get it passed. All it takes is one influential person to be controlled by pharma in one little state. And pharma has its tentacles everywhere. They get people elected. It's like, you got to learn civil disobedience, tell the government to go to hell, preserve your natural rights, individual liberties. I'm a big St. Thomas Aquinas fan. You know, he married natural law with Christian doctrine without any seams. You don't have to be a Christian to believe in natural law. You just have to understand that you were born with certain rights and freedoms. They're not free. You got to fight for them. You know.
Love it, John. Love it. And we're getting lots of thumbs up and hearts as well. What is the bill number in Minnesota? Or what is the title? We actually probably have to wrap this up here pretty quick. So we do have some other questions, but unfortunately, we do have to. We're almost 3 hours here, folks. I do want to leave you with the call to action as well. So let me go ahead and bring my screen for our final slide here. It's been really interesting here tonight. I hope some of you have been inspired to want to investigate some of this data yourselves. But nonetheless, congratulations to everyone that survived the worst pandemic in history by doing absolutely nothing differently. And I look at all this stuff and I think to myself, if we did nothing differently, I think we'd all be in a much better spot. There wouldn't be nearly the deaths. But with all the fear, and fear is the currency of control, and I think it's like a self-fulfilling prophecy here. This vicious cycle, all these deaths used to justify, the lockdowns and all the interventions and all these policies and all that stuff. And it was all kind of created by on its own, like, oh, let's lock the place down. Let's put everyone in these hospitals. Oh, you test positive with this test is not a test, the PCR test. Oh, you're positive. We're going to vent you now. And we saw in those earlier articles, you tested positive, they put you on the vent. Everyone died that was put on the vent. It's just amazing to think back. And when you look back the last 4 years, and a lot of us have, especially a lot of us in Mascot, Minnesota, in 2020, we had a lot of questions. And, we didn't really believe everything that the news is telling us. And now we look back on it, it's like, wow. It feels kind of good to feel, vindicated a little bit, I guess, like I told you so kind of, but in the same time, no, it doesn't, because I know many, many people in my own personal life that have been affected by these lies. I have family members, turbo cancer. I have young family members in their 20s with heart issues. I have friends of family, people in their 20s with heart issues. A neighbor in his 20s that used to run competitive in college, marathons, and all of a sudden out of nowhere has a heart issue. So it's really hitting home, and it's important for us to continue to fight back and stand up. And so thank you so much, John, for taking the time to meet with us here tonight and sharing all your insights with us and all the data. You guys, I put in the chat box there, therealcdc.com is the website. So go ahead and pre-order that book. Get it right now. And like I was alluding to earlier, I want you to be like John, be like us here at Mascot, Minnesota, and request the data yourselves. Don't just take our word for it. Request it yourself. All you have to do is email the Department of Health. I call them the Department of Health sometimes, but anyway, the Department of Health, Minnesota Department of Health. You email them health.datapracticesrequests@state.mn.us. And just ask them nicely for the death stats for any particular year. It's $15 per year, whatever year you want. The year I was showing was 2020, but we've also purchased all the years up to, I think, 2014, so we could do some excess death analysis like that as well. So feel free to do that as well, and you can look into the data for yourself. So everyone, thank you so much for joining us here tonight. It's good to see everyone. I saw a lot of familiar faces/names in the chat box, so very nice to see you all again. It's been a while, and we're gonna wrap us up here. We always like to wrap us up with an independent music artist, and this one is an independent music rapper. His name is Tyson James, and this particular song is called Bodies. And it's a little bit on theme with tonight's meeting. But folks, thank you so much for joining us. Please don't forget, you're not alone. That's another reason we started Mask Off Minnesota. A lot of us felt alone in those early days, walking in the stores without a mask. Not everyone was brave like Sean to sue the government. And so a lot of us kind of met, in this community of people that wanted to stand up and fight for our rights to breathe oxygen and to not inject ourselves with poisons. So I really want to thank you guys for joining us here tonight. And don't forget, you're not alone.